Blood pools beneath fluorescent lights. A military convoy surrounds Ridgeline Memorial Hospital in Ashford, Montana. Armed soldiers storm through glass doors, rifles raised, scanning faces in the emergency ward. Everyone freezes. A commander shouts one name that makes the entire staff go pale. "Where is Emma Graves?" The woman they're hunting stands 30 feet away, invisible in wrinkled scrubs, holding a tray of surgical instruments. She's the nurse they mock, the one doctors blame when procedures fail. The quiet ghost everyone treats like furniture. But the soldiers know what the hospital never learned. Emma Graves was Falcon 9, the combat medic who kept 19 dying operators alive during the Kandahar siege with nothing but field gauze and a broken headlamp. And tonight, the military needs her again. The chief surgeon who suspended her 2 hours ago stares in disbelief as the commander salutes the woman he called incompetent this morning. Emma doesn't smile. She just sets down the tray and walks toward the chaos waiting outside. Before we dive into this story, I want to ask you something. Stay with me until the very end to see how this unfolds. If you're enjoying it, hit that like button and drop a comment telling me what city you're watching from. I love seeing how far these stories travel. Now let's get back to Emma. The smell hit Emma Graves the moment she walked into Ridgeline Memorial at 5:47 a.m. Disinfectant mixed with burnt coffee and something metallic she couldn't name. The ER buzzed with controlled chaos. Monitors beeped, residents shouted orders. A patient screamed somewhere behind curtain 3. Emma clocked in without speaking to anyone. Nobody noticed. 5 years she'd worked here. 5 years of night shifts, double coverage, cleaning up other people's mistakes. 5 years of being the nurse they called when equipment malfunctioned or family members needed calming down. The dependable one. The invisible one. She tied her dark hair back and checked the assignment board. Trauma bay coverage again. 3rd time this week. "Morning, Ghost." Emma didn't turn around. The nickname had stuck after her first month when a resident joked she moved through rooms without making sound. Now everyone used it. Not her name. Just Ghost. Dr. Marcus Webb leaned against the nurse's station, scrolling through his phone. Young, confident. The kind of surgeon who treated nurses like assistants instead of colleagues. "Trauma 2 needs restocking," he said without looking up, "and someone left gauze wrappers everywhere." "I'll handle it." "Yeah, you will." He walked away laughing with another resident. Emma gathered supplies from the storage closet. Her hands moved efficiently, muscle memory from thousands of shifts. Trauma kits. IV sets, saline bags. She counted everything twice because Dr. Richard Cullen, the chief of surgery, had publicly humiliated a nurse last month for miscounting inventory. The ER doors burst open. "Move, we've got a code blue incoming!" Emma stepped aside as paramedics rushed past with a woman convulsing on a gurney, blood pressure crashing, airway compromised. The team swarmed like hornets, doctors shouting orders, nurses scrambling for equipment, residents getting in each other's way. Emma watched from the corner. She saw the problem immediately. The patient's airway was positioned wrong. The resident attempting intubation had the wrong tube size. Nobody noticed because everyone was yelling over each other. She moved closer. "Excuse me." "Not now, Ghost." Dr. Webb didn't look up. "The tube sized, I said not now." The patient's oxygen saturation dropped to 82, then 79. Emma stepped forward anyway. "You need a 6.5. That's a 7. It won't." Dr. Richard Cullen appeared like a thunderstorm, 62 years old, silver hair, the kind of authority that made interns stutter. "Nurse Graves." His voice could freeze water. "Step back. The tube diameter is wrong for her airway. You can see the resistance. Are you questioning my resident's judgment?" "I'm trying to help the patient." Cullen's face darkened. "Your job is to assist, not interfere. Leave. Now." Emma held his stare for 3 seconds. Then she stepped back. They fought the tube for another 90 seconds before Webb finally switched sizes. The patient stabilized. Nobody apologized. Nobody acknowledged Emma had been right. Webb wiped sweat from his forehead and laughed. "Close one." Emma returned to restocking trauma kits. This was her life now. Watching. Waiting. Keeping quiet even when people made dangerous mistakes. Because the 3 times she'd spoken up before, she'd been written up for insubordination and undermining medical authority. The military had been different. In the field, rank mattered less than skill. If you could stop bleeding, clear airways, stabilize spines while mortars fell around you, nobody cared if you were a private or a colonel. Results spoke louder than titles. But Ridgeline Memorial wasn't a combat zone. Here, hierarchy was everything. Doctors stood at the top. Nurses existed to follow orders. And Emma Graves, the woman who'd performed emergency cricothyrotomies inside burning helicopters, now spent her nights restocking bandages and biting her tongue. She'd left the military 18 months ago. The official record said honorable discharge. The truth was more complicated. The mission that ended her career remained classified, buried under redacted files and non-disclosure agreements. 19 operators went in, 7 came back. Emma kept 4 of them breathing long enough to reach evacuation. The nightmares still came most weeks, but nobody at Ridgeline knew. She'd never mentioned her service, never corrected anyone who assumed she'd gone straight from nursing school to hospital work. Easier that way. Cleaner. Let them think she was just another quiet nurse who followed orders. "Ghost!" a resident waved from across the ER. "We need fresh sutures in exam 4. Emma grabbed the supply cart. The morning crawled forward. Patients cycled through. Broken bones, chest pain, a teenager who'd wrapped his car around a telephone pole. Emma worked steadily, efficiently, invisible. At 11 a.m., Dr. Cullen called a staff meeting. Everyone crammed into the conference room. Doctors sat. Nurses stood along the walls. Emma positioned herself near the back exit. Cullen launched into a speech about protocol adherence and maintaining professional boundaries. His eyes found Emma twice during the talk. Both times felt like warnings. Then he shifted topics. "We're implementing new emergency preparedness standards," Cullen announced. "The state requires disaster readiness drills, mass casualty protocols, triage systems." Emma's attention sharpened. "I've reviewed the proposed changes," Cullen continued. "Frankly, they're excessive. We're a regional hospital, not a battlefield MASH unit. I'm streamlining the requirements to something more practical." A younger doctor raised his hand. "What about the expanded triage categories? Those seemed unnecessary," Cullen cut him off. "We'll stick with standard color coding. Red, yellow, green, simple, effective." Emma's jaw tightened. The military used 5-category triage for mass casualties: immediate, delayed, minimal, expectant, deceased. Dropping to 3 categories meant slower sorting, confused prioritization, higher mortality rates when systems got overwhelmed. She raised her hand. Cullen's expression soured. "Yes, Nurse Graves?" "The 5-category system exists because 3 isn't sufficient during actual mass casualty events. When you're dealing with, are you a disaster preparedness specialist?" "No, but I've worked." "Then perhaps you should let the physicians handle medical policy." Cullen's smile didn't reach his eyes. "Your input is noted and dismissed." Laughter rippled through the doctors. Emma felt heat rise in her chest, but kept her voice level. "I'm just saying that in field conditions, the expanded triage—" "Field conditions?" Cullen laughed. "This is Montana, not Afghanistan. We treat car accidents and heart attacks, not combat wounds." More laughter. Webb grinned from the front row. "Maybe Ghost thinks she's a war hero." The room erupted. Emma stood perfectly still while they laughed. Her face showed nothing. Years of military discipline had taught her how to bury emotion beneath a blank expression, but inside something cold and sharp twisted. Cullen raised his hand for silence. "Meeting adjourned. Back to work." Everyone filed out. Emma waited until the room emptied before moving. She walked to the trauma bay and started her afternoon checklist. Inventory. Restocking. Equipment maintenance. The work required no thought, which helped. Her hands moved while her mind stayed carefully blank. 3 hours later, Dr. Cullen found her organizing medication supplies. "Nurse Graves." "My office." "Now." She followed him down the hallway. Other staff members watched from doorways. Everyone knew what a summons to Cullen's office meant. He closed the door and sat behind his desk. Emma remained standing. "You undermined my authority in front of the entire staff today," Cullen said. "I offered medical input. You questioned my judgment. I questioned a policy decision that could cost lives." Cullen leaned back in his chair. You've been a problem since you arrived, Emma. Always hovering, always second-guessing, always thinking you know better than doctors with decades of experience. That's not— I'm suspending you. 2 weeks. Unpaid. The words hit like a physical blow. Emma stared at him. For what? Insubordination. Disrespect. Creating a hostile work environment. Cullen smiled. I've documented every incident, every time you questioned a procedure, every time you spoke out of turn. HR already approved the suspension. This is retaliation. This is consequences. He stood. You're banned from the trauma floor effective immediately. Security will escort you out, clean out your locker, and leave hospital property within the hour. Emma's hands curled into fists at her sides. You're making a mistake. The only mistake was keeping you this long. You're a nurse, Graves. Not a hero, not a doctor. Learn your place or find another hospital. He opened the door. 2 security guards waited outside. Gentlemen, please ensure Nurse Graves removes her belongings and exits the building. Emma walked between them like a prisoner. The hallway felt endless. Other nurses watched from doorways, faces mixed with pity and relief that it wasn't them. Dr. Webb smirked as she passed. In the locker room, Emma gathered her things: spare scrubs, a water bottle, the small photo of her old unit she kept hidden in the back. Her hands shook slightly as she stuffed everything into her backpack. 5 years. 5 years of biting her tongue. 5 years of following orders. 5 years of being invisible. And this was how it ended. The security guards walked her to the main entrance. Other staff members pretended not to notice. Emma pushed through the glass doors into cold Montana air. The afternoon sun hung low over Ashford. Snow dusted the mountains in the distance. Emma stood on the sidewalk outside Ridgeline Memorial and breathed. She'd survived firefights in Kandahar. She'd performed surgery in the back of moving vehicles while insurgents fired at the convoy. She'd held dying soldiers together with pressure and prayer while evac helicopters screamed overhead. But getting fired from a civilian hospital by an egotistical surgeon felt worse somehow. Because in combat, the enemy was obvious. Here, she'd been betrayed by people who were supposed to heal. Emma started walking toward the parking lot. Then she heard it. A sound that made her blood turn to ice. Helicopter rotors, multiple aircraft, low altitude, moving fast. Military birds. Emma turned. 3 Blackhawks materialized over the eastern ridge, flying in tight formation. Behind them, 2 larger Chinooks, all of them bearing military insignia, all of them heading straight for Ridgeline Memorial. Her heart rate spiked. Military helicopters didn't just appear over random Montana towns. Not without reason. Not without— The first Black Hawk touched down in the hospital parking lot. Soldiers poured out before the wheels settled. Combat medics, armed personnel, officers shouting orders. Emma's training kicked in automatically. She counted personnel, assessed movement patterns, evaluated threat levels. This wasn't a drill. This was a crisis response. The second Black Hawk landed. More soldiers, more equipment. A portable triage station began assembling on the asphalt. Emma's phone buzzed. Then every phone in sight started ringing simultaneously. Through the hospital's glass doors, she saw staff members running, alarms activated. The PA system crackled to life with an emergency alert. A military Humvee screeched to a stop near the entrance. An officer jumped out, full combat gear, blood on his uniform. He grabbed the first doctor he saw. Emma couldn't hear the conversation, but she read the officer's body language. Urgent, desperate, pointing at the helicopters. Something terrible had happened. The Chinooks began landing. Their rear ramps dropped. Combat stretchers appeared carried by soldiers moving at a run. Even from 50 yards away, Emma could see the blood. Her feet moved before her brain caught up. She dropped her backpack and started toward the chaos. A security guard stepped in front of her, the same one who'd escorted her out 10 minutes ago. Ma'am, you need to leave hospital property. There are wounded incoming. You're suspended. You can't move. Something in Emma's voice made him step aside. She walked past him, past the parking lot, straight toward the organized chaos unfolding around the helicopters. Soldiers carried stretchers. Medics shouted vitals. Blood painted the asphalt. Emma counted stretchers as they appeared. 6 casualties. No. 8. No. 12. All of them critical. Burns, blast injuries, penetrating trauma. The kind of wounds that killed people if you didn't move fast and smart. A military medic sprinted past carrying IV bags. Emma caught his arm. What happened? He looked at her. Civilian clothes, no rank, no authority, and almost pulled away. Then he saw something in her eyes that made him answer. Training accident, explosives malfunction during a live fire exercise up in the northern range. We've got 23 wounded, 11 critical. We're bringing them here because it's the closest trauma center. He ran toward the hospital entrance. 23 wounded, 11 critical. Emma's mind started working through triage mathematics automatically. Level 1 trauma bay could handle maybe 3 at a time. Ridgeline had 2 bays. That meant 6 patients maximum under ideal conditions. They were about to receive 11 critical casualties simultaneously. The hospital couldn't handle this. Emma walked faster. Through the glass doors, she saw controlled chaos turning into panic. Doctors running, nurses shouting, equipment carts colliding. Dr. Webb stood frozen in the middle of the ER, staring at incoming stretchers like he'd never seen blood before. The military medics brought patients inside in waves. Emma reached the entrance just as Dr. Cullen appeared, trying to organize the chaos. His face had gone pale. Sweat beaded on his forehead. "Trauma 1 and 2, he shouted. "Get me OR prep immediately. Where's my surgical team?" A resident ran past. "Dr. Chen is in surgery. Dr. Morrison is off-site. We don't have enough." "Then find someone." Emma stood just outside the doors, watching. Every instinct screamed at her to move, to help, to do what she'd been trained for. But she'd been suspended. Banned from the trauma floor. Escorted off property. Another stretcher rushed past. The soldier on it couldn't have been older than 22. Shrapnel wounds across his chest. Breathing labored. Someone had started a field IV, but the line was poorly placed and already infiltrating. He'd die if they didn't fix that in the next 3 minutes. Emma's hands clenched. Inside, Dr. Cullen was shouting orders that made no sense, trying to route critical patients to general exam rooms, calling for equipment the hospital didn't have, making the kind of mistakes that happen when civilian doctors faced military-scale trauma without proper training. People were going to die. Emma knew it with the same certainty she knew her own name. She turned to walk away. She'd been fired. It wasn't her problem anymore. She made it 5 steps. Then she heard a voice that stopped her cold. "Wait!" Emma turned. A military officer stood 10 feet away, mid-40s, combat uniform, blood spatter across his sleeves. But it was his face that made Emma's breath catch. Colonel David Nash. She'd served under him in Kandahar. He'd been the one who put her in for commendation after the siege. He'd also been the one who signed her discharge papers when everything fell apart. They stared at each other. Nash's expression shifted from confusion to recognition to something that looked like hope. "Graves." His voice barely carried over the chaos. "Emma Graves?" She didn't answer. Nash closed the distance between them in 3 strides. "What are you doing here?" "I work here." "Worked. Past tense." "You're a nurse at this hospital?" "Was. I got fired about 15 minutes ago." Nash looked at her, then at the chaos inside, then back at her. "How many critical casualties can this place handle?" Emma's throat tightened. 6. Maybe. If everything goes perfectly. We've got 11 that won't make it to Great Falls Regional." "I know." Silence stretched between them. Inside the hospital, alarms started going off. Someone screamed. A crash echoed through the ER as equipment toppled. Nash's jaw clenched. "I need to ask you something, and I need you to be honest. Are you still capable?" Emma knew what he meant. After Kandahar, after the nightmares, after everything that made her leave. Yes. No hesitation? No freezing? No. Nash studied her face, looking for cracks, for doubt, for the 1,000-yard stare that meant someone was broken beyond use. Emma held his gaze steady. Finally, Nash nodded. He pulled out his radio. "Command, this is Nash. I'm implementing emergency medical protocols. We have a specialized combat medic on site. I'm bringing her in under military authority." Static crackled. "Confirm. Civilian facility? Military override?" "Confirmed. We've got dying soldiers and insufficient local resources. I'm exercising field command." "Copy that, Colonel. You're authorized." Nash lowered the radio and looked at Emma. "Falcon 9, he said quietly. the call sign she hadn't heard in 18 months. I need you. Emma glanced at the hospital. Through the glass, she could see Dr. Cullen shouting at nurses, Dr. Webb backing away from a patient bleeding out on a gurney, the entire staff on the edge of collapse. She'd been humiliated, suspended, banned, but soldiers were dying. Emma picked up her backpack from where she'd dropped it. What do you need me to do? Save them. They walked toward the entrance together. The security guard who'd escorted Emma out now tried to stop her coming back in. Ma'am, you can't. Colonel Nash stepped between them. She's with me. Move. The guard looked at Nash's rank insignia and stepped aside. Emma walked through the doors of Ridgeline Memorial for the second time that day. But this time, everything was different. The ER had descended into chaos. Wounded soldiers covered every available surface. Blood pooled on floors. Monitors screamed, residents stood frozen, overwhelmed by the sheer volume of trauma. Dr. Cullen saw Emma enter and his face went purple. What is she doing here? I want her removed immediately. Colonel Nash stepped forward. This is now a military medical emergency operating under federal authority. This woman is a combat trauma specialist, and she's taking operational command of triage and stabilization. Cullen's mouth opened and closed. You can't. I can, and I am. Step aside or be removed. Doctors and nurses stared in shock. The invisible nurse, the ghost, the woman Cullen had fired an hour ago. Emma didn't wait for permission. She dropped her backpack, tied her hair back, and scanned the room with the same tactical assessment she'd used in Kandahar. 12 patients visible, blood pressure crashing on the patient in Bay 1, airway compromise in Bay 2. The soldier near the door had a tourniquet placed wrong, arterial bleed not properly controlled. Her voice cut through the chaos like a blade. You, she pointed at a frozen resident. Bay 1. Start 2 large-bore IVs, push saline wide open. You, she gestured at a nurse. Get me a crash cart and 3 units O negative. You, pointing at Dr. Webb. That tourniquet is placed wrong. Reposition it 2 inches higher or he bleeds out in 4 minutes. Nobody moved. They stared at her like she'd started speaking another language. Emma's expression hardened. Move. Now. Her command voice, the one that made soldiers sprint under fire, broke through the shock. They moved. Dr. Cullen found his voice. You have no authority here. This is my hospital. Emma didn't even look at him. Colonel Nash, please remove that man from the trauma floor. He's interfering with patient care. Nash gestured to 2 soldiers. They escorted Cullen out while he sputtered protests. Emma was already moving to the first patient, 23-year-old male. Shrapnel wounds across chest and abdomen. Breathing shallow, skin pale and clammy. Classic signs of hemorrhagic shock. She pressed 2 fingers against his neck, pulse weak and rapid. I need ultrasound here, now. A nurse wheeled over the machine. Emma ran the probe across his abdomen. There. Free fluid in the peritoneum. Internal bleeding. Probably splenic laceration, maybe liver involvement. He needs surgery within 20 minutes or he's dead. Get me a surgical team. Dr. Chen is still in OR with another patient, someone said. Then find another surgeon. What about Dr. Morrison? He's not on site. Emma's mind raced through options. Limited surgical staff. Too many critical patients. Standard protocols wouldn't work. She needed to change strategy. All right, new plan. We triage for transport, stabilize here, move to Great Falls Regional for definitive care. But we need helicopters with surgical capability. Nash was already on the radio. Get me 2 medevac birds equipped for en route surgery. ETA to Ashford. 18 minutes, Colonel. Make it 12. Emma moved to the next patient, then the next. Her hands worked automatically, checking wounds, placing lines, assessing damage. Her mind ran calculations. Who could wait? Who needed immediate intervention? Who wouldn't survive transport? This was what she'd been trained for. Not the politics, not the hierarchy, not the ego games. This, the work, the mission. Keeping people alive against impossible odds. Behind her, the civilian doctors watched in stunned silence as Emma Graves, the quiet nurse they'd mocked for 5 years, transformed into something they'd never seen before. Dr. Webb approached hesitantly. What do you need me to do? Emma glanced at him. Can you place a chest tube? I've done it in training. Good enough. Patient in Bay 3 has a pneumothorax. Left side. I'll talk you through it. She moved to the next critical patient while calling instructions over her shoulder. Webb followed her commands exactly, his earlier arrogance completely gone. Nurses began working with renewed efficiency. Having someone who knew what they were doing, someone who radiated absolute confidence, broke through the panic. Emma checked vitals on a soldier with severe burns, 40% body surface area. Airways looked clear, but she'd need to monitor for inhalation injury. A young nurse appeared at her elbow. I don't know what to do. Name? Sarah. Okay, Sarah, see that patient? Emma pointed. He needs IV access, 2 lines, 18 gauge. Can you do that? I think so. Don't think, do. I'll check your work in 2 minutes. Sarah nodded and moved with purpose. Emma glanced at the wall clock. Nash's helicopters would arrive in 7 minutes. She needed everyone stable enough for transport by then. Patient by patient, she worked through the casualties, stopping bleeding, securing airways, placing lines, correcting mistakes, prioritizing care. This was mass casualty triage the way it was supposed to work. Fast, efficient, brutal in its logic. Save those you can. Don't waste time on those you can't. Keep moving. The ER gradually shifted from chaos to organized crisis response. Then Emma reached the last patient. He lay on a gurney near the back wall, partially hidden behind a supply cart. Someone had covered him with a sheet, assuming he was already gone. But Emma saw the sheet moving slightly with shallow breaths. She pulled it back. The soldier was older than the others, mid-30s, possibly 40. Sergeant stripes on his torn uniform. His face had been badly burned. Shrapnel wounds covered his torso. Someone had placed a field dressing, but blood had soaked through. Emma checked his pulse. Weak. Thready. But there. She leaned closer to check his breathing pattern. The soldier's eyes opened. For a moment, they were unfocused. Then they locked on Emma's face. His entire body went rigid. His mouth moved, forcing words through damaged airways. Raven. 6? The room went silent. Every military person in the ER turned to stare. Raven 6. Emma's combat call sign. The designation she'd earned in Kandahar when she'd kept a field hospital running for 14 hours while under sustained attack. The name that had become legend among special operations units. The identity she'd buried when she left the military. Colonel Nash's expression shifted. Oh my God. Emma's hands never stopped working. She checked the soldier's injuries while his eyes tracked her movements. You know me? She asked quietly. Black Ridge. His voice barely carried. 18 months ago. You pulled me out of the burning Humvee, kept me breathing until evac arrived. Emma's memory clicked. Black Ridge. The mission that ended her career. The ambush that killed half her team. She'd saved 7 soldiers that day, working in near total darkness, while enemy fire tore through their position. She didn't remember individual faces, just the work, the desperation, the blood. But he remembered her. The soldier grabbed her wrist with surprising strength. They said you disappeared. That Raven 6 just vanished after we got out. I'm here now, Emma said. And you're going to be fine. She worked quickly, reassessing his injuries, worse than she'd initially thought. The burns extended to his airways. She could hear the stridor developing. He'd need intubation within minutes. Get me intubation supplies, she called, and ready a ventilator. Nurses scrambled to comply. Emma prepared to intubate, her hand steady despite knowing every military person in the room was now watching her differently. The ghost nurse. The invisible woman. Was Raven 6 all along? She secured the soldier's airway, connected the ventilator, adjusted settings. His oxygen saturation began climbing back into safe ranges. Outside, helicopter rotors announced the arrival of the medevac birds. Emma stepped back and surveyed the room. 12 critical patients, all stabilized, all ready for transport, all alive. Against the odds, against the chaos, against a hospital that wasn't prepared for this. She'd done it. Colonel Nash appeared at her shoulder. 6 birds are landing. We can transport everyone. Emma nodded. She felt exhausted suddenly, the adrenaline starting to wear off. Nash's voice dropped lower. I didn't know you were here. Didn't know you'd stayed in Montana after discharge. Nobody knew. They do now. Emma looked around the ER. Military medics were already moving patients toward the exits. Civilian staff stood in small groups, whispering, staring at her. Dr. Webb approached carefully. I had no idea. About your service, your experience. Emma didn't respond. Dr. Cullen stood near the entrance, held back by two soldiers. His face had gone from purple rage to ashen shock. He was staring at Emma like he was seeing a stranger. The doors burst open again. More soldiers entered, but these weren't medics. They wore different uniforms. Command staff. One of them scanned the room until his eyes landed on Emma. Brigadier General James Harding walked across the blood-stained floor with his aide trailing behind. Colonel Nash straightened. "Sir." Harding ignored him. He stopped directly in front of Emma. "Captain Graves." The title hit like a physical blow. Emma hadn't been called captain in 18 months. "I'm not," she started. "You never officially resigned your commission," Harding interrupted. "Just took extended leave, which means technically you're still an officer in the United States Army Medical Corps." Emma's chest tightened. "That's not. We have a situation." Harding's expression was grim. "The training accident was worse than initially reported. We've got 43 additional casualties inbound from the northern range. Multiple vehicles hit IEDs during the confusion. Great Falls Regional is already overwhelmed. Billings is too far. We need a trauma response center here, and we need it operational in the next 90 minutes. The room fell silent. Emma stared at him. "This is a civilian hospital. They're not equipped. You just proved they can be with the right leadership." Harding's eyes bored into hers. "I'm implementing emergency medical mobilization protocols. This facility is now operating under military authority until the crisis is resolved, and I'm reactivating your commission effective immediately." "Sir, I can't." 43 soldiers, Captain. Some of them won't survive the flight to Great Falls. This hospital is their only chance. Harding's voice softened slightly. "I'm not ordering you. I'm asking. Will you help?" Emma looked around the room, at the civilian staff who'd spent 5 years treating her like she was invisible, at Dr. Cullen, who'd suspended her for speaking up, at Dr. Webb, who'd mocked her just this morning, at Colonel Nash, who knew what Kandahar had cost her, at the empty gurneys waiting for the next wave of wounded. 43 more soldiers, 43 more people who'd end up on operating tables or in body bags depending on what happened in the next few hours. Emma's hands were still covered in blood from the last batch. She thought about walking away, about letting the arrogant doctors who'd humiliated her figure it out themselves, about returning to her quiet life where nobody knew who she really was. Then she thought about the soldier who'd recognized her, who'd remembered that someone had pulled him out of a burning vehicle and kept him alive when everything was falling apart. Emma took a breath. "I'll need full operational authority, no interference from civilian administration, complete access to all facilities and supplies, and immunity for any staff who follow my orders." Harding nodded. "Done." "I'll also need those doctors." Emma pointed at Cullen and Webb. "All of them. Everyone who works here, because I can't do this alone." "They'll cooperate," Harding said. Emma looked directly at Dr. Cullen. "Will you?" Cullen's face had gone gray. He looked at the general, at the soldiers, at Emma standing there covered in blood with her old military rank hanging in the air between them. His voice cracked. "Yes." Emma nodded once. "Then we have work to do." Emma turned to face the chaotic emergency room, her mind already calculating what needed to happen in the next 90 minutes. The familiar weight of command settled across her shoulders like armor she'd stored away and forgotten how to wear. "Clear the main hallway," she said. "I need every gurney, every bed, every flat surface that can hold a human body moved into a grid formation. Trauma bays stay functional, but everything else converts to mass casualty staging." Nobody moved. They stared at her, boom. The ghost nurse giving orders like a battlefield commander. General Harding's voice cut through the hesitation. "You heard the captain. Move." The ER exploded into motion. Emma walked toward the nurse's station with Colonel Nash beside her. She grabbed a whiteboard marker and started sketching rapid diagrams on the closest wall. "We'll run a 3-tier system," she said, drawing boxes and arrows. Red zone for immediate surgical intervention. Yellow for stabilization and observation. Green for minor injuries and walking wounded. I need clear visual markers, but actual colored tape on the floor, not just tags on patients. We don't have that much colored tape, a nurse said weakly. Emma didn't look up. Then use bed sheets. Red sheets, yellow sheets, white sheets. I don't care if it looks professional. I care if it works. Dr. Webb appeared at her elbow, his earlier smugness completely evaporated. Where do you want surgical teams positioned? Operating rooms stay active for the worst cases, but we're setting up 2 field surgical stations in the main ER. I need sterile fields, instrument trays, and portable lighting. Can you handle that? Webb nodded rapidly. Yes. Yeah, I can do that. Then go. He practically ran. Emma turned to find Sarah, the young nurse from earlier. I need you to inventory every unit of blood we have, every type. Then get on the phone with every hospital within 200 miles and start emergency transfers. We're going to run out. How much do we need? Triple what you think, then double that. Sarah's eyes went wide, but she moved immediately. The hospital transformed around Emma like a living organism responding to new instructions. Doctors who'd spent 5 years ignoring her now hung on every word. Nurses who'd watched her get humiliated this morning now sought her approval for every decision. Emma felt nothing about the reversal. There wasn't time for satisfaction or vindication. 43 wounded soldiers were inbound, and her job was to make sure they didn't die in the hallways of a civilian hospital that had never seen combat trauma. She moved through the converted trauma ward, checking every station. The makeshift triage areas looked crude but functional. Equipment had been staged efficiently. Supply carts positioned at strategic intervals. Dr. Cullen stood near the entrance, watching her work. His face carried an expression Emma couldn't quite read. Shock, maybe. Or the particular shame that came from realizing you'd catastrophically misjudged someone. She ignored him. A military communications specialist set up a radio station near the nurse's desk. Static crackled as he established contact with the inbound convoy. Captain Graves? He held out a handset. Lead vehicle wants to speak with you. Emma took the radio. This is Graves. Go ahead. Captain, this is Major Chen with the convoy. The voice sounded strained. We've got 38 ambulatory patients and 5 critical. 2 of the criticals won't make it without immediate surgical intervention. ETA is 47 minutes, but we're hitting weather. Visibility is dropping and roads are icing over. Emma's jaw tightened. Winter storm moving in, just what they needed. What's the nature of the critical injuries? 1 severe head trauma with increasing intracranial pressure. 1 bilateral femur fractures with suspected pelvic involvement. 1 penetrating chest wound with possible cardiac tamponade. 2 with severe burns and airway compromise. Emma's mind processed the information automatically. Head trauma needed a neurosurgeon. Pelvic fractures needed an orthopedic specialist and probably vascular surgery. Cardiac tamponade needed immediate pericardiocentesis. Ridgeline Memorial had none of those specialists on site. Copy that, Major. We'll be ready. Drive safe. She lowered the radio. Colonel Nash had been listening. We don't have the surgical specialties for those cases. I know. Great Falls is still an option for the criticals. Emma looked at the windows. Snow had started falling. Light flurries that would become a blizzard within the hour based on the cloud patterns. They won't make it, she said quietly. Not in this weather. Not with 47 minutes already on the clock. So what do we do? Emma turned to scan the room. Her eyes landed on Dr. Cullen, still standing uselessly near the wall. She walked over to him. Cullen straightened as she approached, trying to summon some of his earlier authority. It didn't work. He just looked old and tired. I need to know your surgical experience, Emma said. Real experience, not what's on your resume. Have you ever handled a pericardiocentesis? Cullen blinked. Yes. During my residency, but that was, how many? Maybe a dozen. But Captain, I haven't performed that procedure in over 15 years. It's like riding a bike. Emma's voice carried zero sympathy. You're doing it tonight. The color drained from Cullen's face. I can't. The liability alone. General Harding, Emma called across the room. The general looked up from where he'd been coordinating with his staff. Yes, Captain? I need written orders granting full medical immunity to all civilian personnel operating under my command during this emergency. Can you provide that? Consider it done. Emma turned back to Cullen. There's your liability protection. Now, can you perform the procedure or not? Cullen's mouth worked silently. Emma watched him struggle. The man who'd spent the morning lecturing her about knowing her place, now being forced to answer whether he could actually do the job when lives depended on it. I'll need assistance, he finally said. You'll have it. I'll walk you through every step if necessary. Emma's expression hardened. But that soldier is not dying because your ego is more comfortable with theory than practice. Something shifted in Cullen's face. The last traces of his superiority complex crumbled, leaving behind what looked like genuine fear mixed with shame. Understood, he said quietly. Emma moved on. She found Dr. Webb organizing surgical instruments with surprising efficiency. His hands shook slightly as he worked. Talk to me about orthopedic trauma, Emma said. Have you handled complex fractures? Some, mostly in training rotations. I'm not certified for... I don't care about certifications. Can you set bilateral femur fractures if I give you step-by-step guidance? Webb looked at her, really looked at her, maybe for the first time since she'd started working at Ridgeline. I don't know, he said honestly. I've never done it outside a controlled teaching environment. At least he was being truthful now. Here's what's going to happen, Emma said. You're going to do it anyway, because the alternative is that soldier loses his legs or bleeds out internally. I'll be right there. I've set fractures in the back of moving helicopters with mortars landing 50 yards away. You'll have a sterile environment, proper equipment, and my full support. What if I mess up? Then we fix it, but you don't freeze and you don't quit. Clear? Webb swallowed hard. Clear. Emma's radio crackled again. Captain Graves, this is the medevac command. We've got a problem. Emma's stomach sank. Go ahead. Weather is deteriorating faster than predicted. We're grounding all helicopter operations in the next 15 minutes. The convoy is your only inbound, and they're struggling with road conditions. ETA is now pushing 65 minutes. 65 minutes? That meant the critical patients had over an hour of transport time before they'd even reach the hospital. The head trauma case wouldn't last that long. Increased intracranial pressure would lead to herniation. Brain death. Emma keyed the radio. Can you patch me through to the convoy's medical team? Stand by. Static hissed for several seconds. Then a new voice came through, young and stressed. This is Specialist Morrison with Convoy Medical. Who am I speaking with? Captain Emma Graves. I'm running triage at Ridgeline. I need a status update on your head trauma patient. He's deteriorating, pupils are becoming unequal and sluggish. Glasgow coma scale dropping. I think he's herniating. Emma closed her eyes briefly. Do you have mannitol? Negative. We used our supply on earlier casualties. What about hypertonic saline? Limited supply. Maybe 1 dose. Emma's mind raced through options. Increasing intracranial pressure needed reduction before permanent brain damage occurred. Standard treatment was mannitol or hypertonic saline to reduce brain swelling, but without adequate supplies and with over an hour until arrival, they needed a different approach. Listen carefully, Emma said. I need you to elevate his head to 30 degrees. Keep him sedated to reduce metabolic demand. If you have any saline left, give him 3% solution, 250 milliliters over 15 minutes. Monitor his respiratory rate closely. If he starts bradying down, you bag him manually. Copy that. What about the hyperventilation protocol? Emma hesitated. Hyperventilation could reduce intracranial pressure, but it also risked causing cerebral ischemia if overdone. Only if absolutely necessary. If his condition crashes before you reach us, hyperventilate to a CO2 of 30 to 35, but no lower. Understood? Understood. And Morrison, you're doing fine. Keep him alive until you get here. We'll handle the rest. The radio went quiet. Emma turned to find Colonel Nash watching her with an unreadable expression. What? She said. Nothing. Just remembering why you earned that call sign. Emma didn't respond. She walked back to the command board and started revising her triage setup. If the head trauma patient arrived actively herniating, they'd need immediate surgical decompression. That meant a craniotomy, drilling burr holes into the skull to relieve pressure. Ridgeline Memorial didn't have a neurosurgeon. Emma found Sarah restocking supply carts. I need you to pull together a craniotomy kit. Sterile drill, burr attachments, bone wax, irrigation supplies. Check the orthopedic surgical sets. They should have most of what we need. Sarah's face went white. We're going to drill into someone's skull? If it keeps them alive, yes. But who's going to perform the procedure? We don't have anyone trained in— I am. The words hung in the air between them. Sarah stared. You're a nurse. I'm a combat surgeon who happened to hold nursing credentials. Emma's voice stayed flat. I performed field craniotomies twice. Both patients survived. Now please get me that kit. Sarah nodded shakily and hurried away. Emma sensed movement behind her. She turned to find several staff members had overheard the conversation. They were looking at her like she'd sprouted a second head. Dr. Webb spoke first. You're a surgeon. I have emergency surgical training. Field medicine is different from civilian practice. But you've been working as a nurse here for 5 years, because nursing positions were available and surgical positions weren't. Emma's patience was wearing thin. Does this matter right now? Nobody answered. Then get back to work. They scattered. Emma checked the wall clock. 38 minutes until the convoy arrived, assuming road conditions didn't get worse. She needed to use that time to prepare for scenarios that would make most civilian doctors quit medicine. She gathered the senior medical staff in the converted trauma bay. Dr. Cullen, Dr. Webb, 3 other physicians who'd been called in from off-duty, and a handful of experienced nurses. Here's the reality, Emma said without preamble. We're about to receive casualties that would challenge a level 1 trauma center with full specialist coverage. We don't have specialists. We don't have ideal equipment. What we have is basic surgical capability, a lot of determination, and the fact that these soldiers will die if we don't try. She pointed at the whiteboard where she'd sketched out patient assignments. Cullen, you're taking the cardiac tamponade case. I'll assist and guide you through the pericardiocentesis. Webb, you're on orthopedic trauma with support from Dr. Harrison. The burn cases will be handled by Dr. Foster with nursing support for airway management. Emma paused. The head trauma case is mine. If anyone has moral or professional objections to working outside their normal scope of practice, leave now. Nobody moved. Good. Because there's one more thing you need to understand. Emma's voice dropped lower. Some of these patients won't make it. We're going to lose people tonight. When that happens, we don't stop. We move to the next patient and we keep working. Grief comes later. Right now, we save everyone we can. The room stayed silent. Dr. Cullen spoke hesitantly. Captain, Emma, I owe you an apology. Not now. I need to say this. I was wrong. About you. About the way I treated you. About— I said not now. Emma's eyes were hard. You can apologize after the last soldier walks out of here alive. Until then, I need a doctor, not a guilty conscience. Are you capable of being that doctor? Cullen straightened slightly. Yes. Then prove it. Emma dismissed them to final preparations and walked to the window. Snow fell heavily now, coating the parking lot in white. Visibility had dropped to maybe 100 yards. The convoy was fighting through that storm with dying soldiers in the back of every vehicle. Her radio crackled. Captain Graves, this is Morrison. We've got a major problem. Emma's hand tightened on the radio. Talk to me. The chest wound patient just crashed. He's in PEA arrest. We're running CPR, but I think he's got a tension pneumothorax on top of the tamponade. I need to decompress his chest, but I've never done a needle thoracostomy without supervision. Emma looked at the clock. The convoy was still 40 minutes out. Walk me through what you're seeing, she said, forcing her voice to stay calm. Morrison's words came fast. Absent breath sounds on the right side, tracheal deviation to the left. JVD. We're bagging him, but we're not getting good chest rise. Classic tension pneumothorax. Air trapped in the chest cavity, collapsing the lung and shifting the heart. Fatal without immediate decompression. You need to decompress now, Emma said. Do you have a needle catheter kit? Yes. 14-gauge angiocath. Good. Find the second intercostal space on the right side, mid-clavicular line. You're looking for the spot just below the collarbone, second rib space. Feel for it. I've got it. Clean the area with alcohol. Insert the needle at a 90-degree angle just above the third rib. You're going to feel resistance from the chest wall, then a pop as you enter the pleural space. As soon as you hear a rush of air, you've decompressed the tension. Leave the catheter in place and secure it. You following? I'm terrified I'm going to hit something vital. You won't. The needle goes in just above the rib to avoid the neurovascular bundle below. Trust your training. Do it now. She heard Morrison breathing hard over the radio. Background noise suggested someone was still doing chest compressions. Inserting now, Morrison said. 15 seconds of silence that felt like hours. Then Morrison's voice came back, shaky but relieved. I heard the rush. Air's escaping. His chest is rising better when we bag him. Good. Now check for pulses. More silence. We've got a pulse, weak but present. He's back. Emma allowed herself a small breath. Maintain the decompression. Monitor his breathing. If he crashes again, you'll need to do the other side. You did good, Morrison. Thank you, ma'am. I thought he was gone. He's not gone until he's cold and gone. Keep him warm and keep moving. Emma lowered the radio to find half the ER staff staring at her. They'd been listening to the whole exchange. She didn't have energy to care what they thought anymore. Sarah appeared with the craniotomy kit, laid out on a sterile tray. Emma inspected the contents. Not ideal, but workable. The orthopedic drill would function. The burr attachments looked adequate. She'd worked with worse in field hospitals. General Harding approached with a satellite phone. Captain, I have command on the line. They're asking for a status update. Emma took the phone. Graves here. A crisp voice came through. Captain, this is Colonel Patterson from Medical Command. I need your honest assessment. Can that facility handle this patient load? Emma looked around the converted emergency room. Civilian doctors preparing for procedures they'd never performed outside textbooks. Nurses setting up surgical stations with equipment designed for different purposes. A hospital that this morning had suspended her for questioning their disaster preparedness now turned into a makeshift combat hospital. We'll make it work, Emma said. That's not what I asked. It's the only answer that matters. These soldiers are coming here regardless. The question isn't whether we're ready, it's whether we'll do everything possible to save them when they arrive. Silence on the other end. Then Patterson spoke again, his voice slightly warmer. Understood, Captain. You have full support from Medical Command, whatever you need. I need the weather to clear so we can evacuate the patients who need specialist care after we stabilize them. We're working on it. Forecast shows the storm passing in approximately 4 hours. 4 hours. Emma could work with that. Stabilize everyone, then transfer the complex cases to Great Falls once the helicopters could fly again. She handed the phone back to General Harding. They're going to write reports about this, Harding said quietly. About you taking command. About what happens tonight. Let them write whatever they want. I'm serious, Emma. This could change things for you. Reinstatement, promotion, a position at Walter Reed or Bethesda. You could write your own ticket. Emma looked at him. I don't want a ticket. I want those soldiers to live. And after? What then? She didn't have an answer. The radio crackled again. Captain Graves, convoy is 25 minutes out. All patients currently stable, but weather is getting worse. We're moving as fast as we can. Emma keyed the mic. Copy that. We're ready for you. She turned to face the assembled medical staff. They looked nervous but determined. Even Dr. Cullen had lost his earlier hesitation, replaced by the focused intensity of a surgeon preparing for a difficult case. Final equipment check, Emma called out. Surgical teams verify instrument counts. Nursing staff confirm medication availability. Everyone double-check your stations. The ER hummed with activity. Emma walked through each triage area personally. Red zone, 2 operating tables set up with portable lights and full surgical kits. Yellow zone, 6 beds arranged for monitoring and stabilization. Green zone, additional beds for minor injuries and observation. It looked nothing like a proper trauma center, but it might be enough. She paused near the entrance, looking out at the storm. Somewhere in that white chaos, a convoy of wounded soldiers was fighting through ice and snow to reach this building. Dr. Webb joined her at the window. Can I ask you something? Emma didn't look at him. Make it quick. This morning, when I called you Ghost, when we all treated you like you were... He trailed off. Worthless? Emma supplied. Invisible? Too stupid to understand real medicine? Webb flinched. Yeah, why didn't you ever say anything? About your service? About what you could do? Emma watched snow swirl against the glass. Because I left that person behind when I left the military. I wanted to be just a nurse. Someone who helped without being in charge. Someone who could clock out at the end of a shift and go home to a quiet life. But you weren't just a nurse. I tried to be. Emma's voice carried old exhaustion. Turns out you can't run from what you are, even when you want to. Webb stood silent for a moment. For what it's worth, I'm sorry. Save your apology for the soldiers. Use it as motivation to not mess up when their lives are in your hands. I won't let you down. Emma finally looked at him. Don't let them down. I don't matter. She walked away before he could respond. The minutes crawled past. Emma used the time to review procedures in her mind. Every step of every surgery she might need to perform. Craniotomy, thoracotomy, emergency laparotomy. Her hands remembered the movements even if her conscious mind sometimes doubted. At 15 minutes out, the convoy radioed again. Captain Graves, we've got another situation. One of the burn patients is developing respiratory distress. I think his airway is swelling shut. Emma grabbed the radio. Is he conscious? Barely. He's working hard to breathe. You need to intubate him now, before the swelling progresses and makes it impossible. Ma'am, I've only done intubations on training dummies. Then this is your first real one. Talk me through your equipment. She walked Morrison's medic through the procedure step by step, positioning the patient, selecting tube size, visualizing the vocal cords, advancing the tube. Her voice stayed calm and methodical even as she heard the panic in the medic's responses. 3 minutes later, the airway was secured. He's in, the medic said, breathing hard. I've got good chest rise and CO2 return. Excellent work. Secure the tube and keep monitoring. 10 minutes until you're here. Emma lowered the radio. Her hands were steady, but she could feel tension coiling through her shoulders and neck. 10 minutes. She walked to the red zone and checked the surgical setup one final time. Everything was ready. Instruments laid out. Medications drawn up. Monitors active. All they needed now were the patients. The staff had gathered in small groups, nervous energy radiating through the room. Emma saw it in their faces. The reality of what they were about to attempt finally hitting home. She raised her voice to carry across the ER. Listen up. When those doors open, we're going to get hit with more trauma than most of you have seen in your entire careers. It's going to be loud, chaotic. Some of you are going to feel overwhelmed. Everyone was watching her now. Remember this? You were chosen for this work because you're capable. I wouldn't be putting any of you in these positions if I didn't believe you could handle it. Trust your training, trust each other, and trust that we're going to save lives tonight that nobody else could save. She paused. These soldiers trusted their country. Their country is trusting this hospital, and I'm trusting you. Don't prove me wrong. Silence filled the room. Then Dr. Cullen spoke up. We won't. Other voices joined in. Agreement, determination. The fear was still there, but it had transformed into something useful. Emma nodded once. Then let's get to work. She had just turned back to her station when the radio crackled one final time. Captain Graves, convoy is pulling into the hospital grounds now. We're coming in hot with 5 critical and multiple urgents. Be advised, the head trauma patient just seized. He's postictal now, but his pupils are blown. I think he's actively herniating. Emma's blood turned cold. Blown pupils meant the brainstem was being compressed. Minutes away from irreversible brain death, she looked at the craniotomy kit on the surgical table. Copy that. Get him inside immediately. Everyone else, prepare for mass casualty reception. This is it. The radio went dead. Outside, through the snow, vehicle lights appeared. Military ambulances sliding through ice, their sirens cutting through the storm. The ER fell into tense silence. Emma pulled on surgical gloves, the latex snapping against her wrists with familiar finality. The first ambulance screeched to a stop directly in front of the entrance. Doors flew open. Medics burst through carrying a stretcher at a run. The soldier on it was unresponsive, blood trailing from his ears, his eyes fixed and dilated. Emma met them halfway across the ER floor. Straight to the red zone, now! They moved as one unit, the stretcher hitting the surgical table as Emma was already positioning herself at the patient's head. Her hands moved automatically, checking pupils, assessing the blown left pupil that meant herniation. Sarah appeared at her elbow with the craniotomy kit. Emma grabbed the drill. Behind her, more ambulances arrived, more stretchers, more soldiers bleeding and broken. Dr. Cullen moved to receive the cardiac patient. Webb took position for the orthopedic case. The entire ER transformed into controlled chaos. But Emma heard none of it. Her entire focus narrowed to the young soldier in front of her, the drill in her hand, and the knowledge that she had maybe 5 minutes to relieve the pressure, killing his brain. She marked the surgical site with a pen, 2 spots on the right side of his skull where she'd place burr holes. "Prep the area," she told Sarah. "Betadine, then drape everything except the surgical field." Sarah's hand shook, but she worked quickly. Emma tested the drill. It whined to life, the sound sharp and clinical. She positioned the burr at the first marked spot. This was it. The moment where theory became reality, where 5 years of hiding behind a quiet nurse's mask ended and everything she'd been came flooding back. Emma took one breath. Then she pressed the drill bit against the soldier's skull and began to cut. The drill bit pierced bone with a sound like ice cracking under pressure. Emma maintained steady downward force, feeling the resistance change as the burr penetrated through skull into the epidural space. Blood welled up around the drill site, dark and venous. "Suction," Emma said. Sarah fumbled with the suction catheter, her hands shaking so badly she almost dropped it. Emma didn't look up, didn't acknowledge the panic. She just kept drilling, counting seconds in her head, feeling the subtle shift that meant she was almost through. The drill broke through. Pressurized blood erupted from the hole, spraying across Emma's face shield. The epidural hematoma had been massive, compressing the brain with lethal force. Now it vented through the burr hole, dark clots mixing with fresh blood. "Jesus," Sarah whispered. Emma ignored her. She irrigated the hole, confirming she'd penetrated completely without going too deep. The bleeding was already slowing as the pressure equalized. She marked the second site and positioned the drill again. Behind her, chaos reigned. Dr. Cullen's voice rose above the noise. "I can't visualize the pericardium. There's too much blood." "Then suction and retract," Emma called over her shoulder while drilling the second burr hole. "You're looking for the fibrous sac around the heart. It's right there. Feel for it." "I don't feel for it." She heard Cullen take a shuddering breath, then go quiet, focused. The second burr hole completed. More blood vented, less forcefully than the first, but still significant. Emma irrigated both holes and packed them with hemostatic gauze. "Check his pupils," she told Sarah. Sarah grabbed a penlight with trembling fingers and shined it in the soldier's eyes. The left one. "It's starting to respond, just a little." Emma allowed herself 1 second of relief. The herniation was reversing. Brain tissue that had been compressed was now getting blood flow again. He wasn't out of danger, not even close, but he had a chance. She looked at the monitor. Heart rate 118, blood pressure 94/62. Low but holding. "Start him on mannitol, 0.5 grams per kilogram, and get me a CT scanner ready for when he's stable enough to move." "We don't have a CT tech on site," Sarah said. "He left after his shift ended." Emma's jaw clenched. Of course he did, because this was a small regional hospital that had never planned for a military mass casualty event. "Then someone needs to call him back, now." A nurse ran to make the call. Emma turned to assess the rest of the red zone. Dr. Cullen had his hand inside the cardiac patient's chest cavity, face pale but determined. Dr. Webb was examining x-rays of the bilateral femur fractures, looking like he might vomit. The burn patients were being intubated by Dr. Foster, who worked with surprising competence despite the severity of the injuries. Across the ER, more stretchers kept arriving. The yellow zone was filling fast. Some patients moaned in pain, others lay eerily quiet. Emma caught Colonel Nash's eye from across the room. He was helping triage, directing patients to appropriate areas based on her earlier instructions. He gave her a slight nod. They were holding. Barely. Emma moved to check on Cullen's progress. The older surgeon had his hands buried in the patient's chest, sweat dripping down his face, despite the cold air being pumped through the ER. "I've got the pericardium exposed," Cullen said, his voice tight. "I can see the tamponade. There's blood in the pericardial sac compressing the heart." "Good. Now you need to drain it. Make a small incision in the pericardium, inferior to the left ventricle. Watch for the phrenic nerve." Cullen's hands moved with agonizing slowness. Emma watched him work, resisting the urge to push him aside and do it herself. He needed to do this. Needed to prove he could function when people's lives actually depended on his skills instead of his title. The scalpel penetrated the pericardium. Dark blood gushed out, pooling in the chest cavity. "Suction that," Emma said, "and watch the heart. It should start contracting more effectively as the pressure releases." The monitor showed immediate improvement, heart rate dropping from 142 to 118, blood pressure rising from 76/48 to 94/58. "It's working," Cullen breathed. "Keep going. You need to evacuate all the blood from the pericardial space, then find the source of bleeding and repair it." Cullen nodded, some of his confidence returning now that he could see results. Emma moved to Webb's station. The younger doctor had the X-rays displayed on a light board, studying the complex fracture patterns with obvious anxiety. "Talk me through what you're seeing," Emma said. Webb pointed at the films. "Bilateral midshaft femur fractures. The right side looks relatively clean, but the left has multiple fragments. There's also what looks like an acetabular fracture on the left hip. Treatment plan? I need to stabilize both femurs with external fixation, but the acetabular injury complicates things. If the hip socket is compromised—" "One problem at a time," Emma interrupted. "The femurs are the immediate threat because of hemorrhage risk. Get external fixators on both legs to control bleeding and provide stability. We'll worry about the hip once he's not at risk of bleeding to death." Webb looked at her. "I've never placed an external fixator outside a controlled OR environment. I've placed them in the back of helicopters. You've got better conditions than I did. You can do this." "What if I damage the nerves or blood vessels?" Emma's voice hardened. "What if you don't try and he loses both legs from uncontrolled hemorrhage? Stop thinking about what could go wrong. Focus on what needs to happen." Webb swallowed and nodded. He turned to the instrument tray and selected the first fixator pin. Emma watched him mark the insertion sites on the patient's leg. His hand still shook, but he was moving forward instead of freezing. A crash from across the ER made everyone jump. One of the yellow zone patients had gone into respiratory distress. Nurses swarmed the bed, but Emma could see from 30 feet away that they were overwhelmed. She ran. The patient was a young soldier, maybe 25, with burns across his face and neck. The endotracheal tube that had been placed in the field was dislodged, and his airway was swelling shut from thermal injury. Emma grabbed a laryngoscope. "Hold his head steady." She positioned herself at the head of the bed and opened the soldier's mouth. The vocal cords were swollen and angry-looking, partially obscured by edema and secretions. This was going to be difficult. Emma inserted the laryngoscope blade, sweeping the tongue aside to visualize the airway. She could barely see the opening between the swollen cords. "ET tube, size 7, she said. A nurse slapped the tube into her hand. Emma guided it toward the opening, feeling resistance as it passed through the narrowed airway. She advanced it carefully, watching for the depth markings. The tube went in. She inflated the cuff and attached the bag valve mask. The patient's chest rose with each squeeze of the bag. "Get him on a ventilator," Emma ordered, "and increase his sedation. If he fights the tube with an airway this swollen, he'll make it worse." She stepped back, letting the nurses take over. Her radio crackled. General Harding's voice came through. "Captain Graves, we have additional casualties inbound. A second convoy that was delayed by weather is approaching. 10 more patients, 3 critical." Emma closed her eyes briefly. "How long?" 20 minutes. She keyed the mic. "Understood. We'll be ready." But they weren't ready. The ER was already operating at capacity. Every trauma bay was occupied. The yellow zone was full. Staff members were running on adrenaline and fear. Emma scanned the room, calculating resources and space. They'd need to convert part of the green zone to handle overflow criticals. That meant moving the minor injuries somewhere else. "Colonel Nash," she called, "I need you to coordinate moving all green zone patients to the cafeteria. Set up a temporary holding area there. We need this space for the next wave." Nash moved immediately, gathering soldiers to help transport patients. Emma returned to her craniotomy patient. His vitals had stabilized somewhat, but he was still unconscious and would need intensive monitoring. The burr holes had relieved the immediate pressure, but he needed a proper CT scan to assess for additional bleeds and a neurosurgeon to evaluate for definitive surgery, neither of which were available. She documented his vitals on the chart and moved on. There were too many patients who needed attention to linger on one. Dr. Foster called from the burn station. "Captain, I need help here. This patient's oxygen saturation is dropping despite maximal ventilator settings. Emma crossed to the burn bay. The soldier on the table had extensive burns covering at least 50% of his body. His lungs had been damaged by smoke inhalation, and now they were failing to oxygenate his blood adequately. Emma listened to his chest with a stethoscope. Coarse breath sounds bilaterally, with pronounced wheezing. ARDS, acute respiratory distress syndrome. His lungs were filling with inflammatory fluid, preventing oxygen exchange. Increase his PEEP to 12, Emma said, and start him on an albuterol ANEB. We need to open up his airways and recruit collapsed alveoli. His blood pressure is already borderline low. If we increase PEEP, we risk dropping his pressure further, I know, but if we don't improve his oxygenation, his brain and organs will start dying from hypoxia. Start a norepinephrine drip to support his blood pressure while we adjust the ventilator. Foster nodded and made the adjustments. Emma moved back to check on Webb's progress with the femur fractures. The younger doctor had successfully placed 2 external fixator pins in the right femur and was preparing to place the connecting rod. His technique wasn't perfect. The pins weren't positioned at ideal angles, but they were functional. The important thing was that the fracture was now stabilized and the hemorrhage risk was controlled. "How's it going?" Emma asked. Webb looked up, sweat dripping into his eyes. "I think I'm doing it right." "You are. Keep going." She checked the patient's vital signs. Blood pressure had stabilized at 102/64. Heart rate was down to 94. The external fixation was working. Dr. Cullen called from his station. "Captain, I've evacuated the pericardial blood, and I think I've found the bleeding source. There's a laceration on the right ventricle, maybe 2 centimeters long." Emma walked over. Cullen had done good work. The surgical field was relatively clean considering the circumstances. She could see the tear in the heart muscle, blood oozing from it with each contraction. "You need to repair it with interrupted sutures," Emma said. "Use 4-O-proline on a cardiac needle. Place the sutures perpendicular to the laceration to distribute tension. And be gentle. The myocardium is fragile." Cullen's hands trembled as he prepared the suture. "What if I tear the heart tissue?" "Then you place another suture, but you won't tear it if you work carefully." She watched him place the first stitch. His technique was rusty but adequate. The suture held without tearing through. "Good," Emma said. "Keep going." She left him to complete the repair and moved to assess the overall situation. The ER looked like a war zone. Blood on the floors, discarded equipment everywhere, exhausted staff moving between patients. But everyone was still alive. The entrance doors burst open again. The second convoy had arrived early. More stretchers flooded in. More soldiers bleeding and broken. The organized chaos threatened to tip into pure pandemonium. Emma grabbed her radio. "All staff, second wave is here. Red zone teams continue current procedures. Yellow zone staff prepare to receive new criticals. Stay focused and stay moving." She met the first stretcher at the door. A young female soldier, unconscious, with a massive abdominal wound. Emma could see intestines protruding through torn combat gear. "Straight to Red Zone Bay 3, Emma ordered. "Someone get me a surgical kit." They moved the patient to an empty table. Emma cut away the field dressing to expose the full extent of the injury. The blast had torn through her abdomen, lacerating bowel and probably damaging major vessels. This needed a laparotomy, opening the abdomen to control bleeding and repair damaged organs. Emma looked around. Every surgeon was occupied. Foster with burns, Cullen with cardiac repair, Webb with fractures. She was on her own for this one. "Sarah," Emma called, "I need you to assist me with an emergency laparotomy." Sarah's face went white. "I'm a nurse, not a surgical assistant." "You're whatever I need you to be right now. Scrub in." They moved fast. Emma prepped the surgical field while Sarah scrambled to get sterile gloves on. The patient's blood pressure was dropping, 88/52 and falling. Emma made the midline incision, cutting through skin and fascia to open the abdominal cavity. Blood welled up immediately, obscuring her view. "Suction," she said. Sarah got the suction catheter in position. Emma worked rapidly, using her hands to explore the abdominal cavity and identify bleeding sources. She found the first laceration in the small bowel, then a second. Then she felt the source of major bleeding. The inferior vena cava had been nicked by shrapnel. "Damn," Emma muttered. The vena cava was the body's largest vein, returning blood from the lower body to the heart. A laceration there could exsanguinate a patient in minutes. She needed vascular clamps. "Now." "Get me 2 DeBakey clamps," Emma said, "and have 2 units of O-negative blood ready to transfuse." Sarah moved to comply, her hands shaking so badly she dropped the first clamp. Emma waited, forcing herself to stay calm while blood continued pumping from the patient's abdomen. Sarah finally got the clamps into Emma's hands. Emma placed them proximal and distal to the laceration, controlling the bleeding temporarily. The patient's blood pressure stabilized slightly, 94/58. Now came the difficult part. She needed to repair the vena cava while it was clamped, which meant working fast before the lack of venous return caused cardiac complications. Emma grabbed a vascular suture kit and began placing interrupted sutures across the laceration. Her hands moved automatically, muscle memory from field hospitals in Kandahar taking over. 1 stitch. 2. 3. The patient's heart rate began climbing. 118, 126, 134. "She's going into tachycardia," Sarah said, panic creeping into her voice. "I know, keep suctioning." 4 stitches. 5. The laceration was almost closed. The monitor alarm screamed, heart rate 156, blood pressure 86/48. "She's crashing," Sarah said. Emma placed the final suture and released the distal clamp. Blood flow resumed through the vena cava. She released the proximal clamp and watched the repair hold. No leaking. The patient's heart rate began dropping. 142, 128, 114. Blood pressure rising, 92/56, 98/62. Emma allowed herself a breath. "Start transfusing those 2 units," she told Sarah. "And get me irrigation fluid. I need to wash out the abdomen before closing." She spent the next 15 minutes methodically examining every inch of the abdominal cavity, looking for additional injuries. She found 2 more bowel lacerations and repaired them. She checked the liver, spleen, kidneys, all intact. Finally satisfied there were no more injuries, Emma began closing. Layer by layer, she reconstructed the abdominal wall. A commotion erupted from Webb's station. Emma looked up to see the orthopedic patient seizing. His entire body convulsed violently, threatening to dislodge the external fixators that had just been placed. "Someone help!" Webb shouted. Emma stripped off her bloody gloves and ran to the bed. The seizure was full tonic-clonic, the soldier's muscles contracting with enough force to potentially break bones. "Hold him steady," Emma ordered. "Don't let him injure himself on the fixators." 2 nurses grabbed the patient's shoulders while Emma prepared a dose of lorazepam. She pushed it through his IV line. 10 seconds. 20. 30. The seizure continued. Emma prepared a second dose, doubling the amount. "That's a lot of benzo," Webb said nervously. "I'm aware." She pushed the second dose. This time the seizure began to subside. The violent convulsions decreased to tremors, then finally stopped. The patient went limp. Emma checked his pupils. Both reactive. She listened to his breathing, regular and unlabored. "What caused that?" Webb asked. "Could be a lot of things. Hypoxia, electrolyte imbalance, traumatic brain injury we didn't catch." Emma shook her head. "Add it to the list of things we'll need to investigate once everyone's stable." She returned to her abdominal surgery patient just as Sarah was finishing the blood transfusion. "How is she?" Emma asked. "Vitals are holding. Blood pressure 104/68. Heart rate 98. Emma nodded. "Good. When I'm done closing, she needs to go to yellow zone for monitoring. Watch for signs of rebleeding." She completed the closure and stepped back. The patient had survived a massive abdominal injury that would have killed her without immediate surgical intervention. Emma looked at the wall clock. 2 hours had passed since the first convoy arrived. It felt like both 10 minutes and 10 years. Dr. Cullen appeared at her elbow, his surgical gown soaked with blood. "I've completed the cardiac repair. The heart is contracting well and blood pressure is stable." "Good work," Emma said. Cullen looked at her with an expression she couldn't quite parse. "I couldn't have done that without your guidance." "You did the work. I just talked you through it." "No." Cullen shook his head. "You gave me the confidence to try. If you hadn't been here—" He trailed off. Emma didn't respond. She was too tired for whatever conversation Cullen was trying to have. Colonel Nash approached with a status update. All patients from both convoys are now inside and receiving care. We have 3 remaining criticals in surgery, 12 in yellow zone monitoring, and 8 in green zone with minor injuries. Casualties? Emma asked. None so far. Everyone who came through those doors is still alive. Emma felt something unclench in her chest. Not relief exactly. There was still too much work ahead for that. But a small measure of hope that maybe they could actually pull this off. The radio crackled. General Harding's voice came through, strained. Captain Graves, I need you to step outside for a moment. We have a situation. Emma's stomach dropped. What kind of situation? Just come outside, now. She walked through the ER toward the entrance, her mind racing through possibilities. More casualties? Equipment failure? Some kind of political interference? She pushed through the doors into cold Montana air. General Harding stood in the parking lot, illuminated by the floodlights the military had set up. He wasn't alone. A woman in civilian clothes stood beside him. Mid-50s, professional demeanor, carrying a briefcase. Behind her, 2 men in suits. Emma recognized the type immediately. Lawyers. Captain Graves, the woman said. I'm Jennifer Patterson, General Counsel for the Montana State Medical Board. These are representatives from the hospital's legal team. Emma's hands clenched into fists. We're in the middle of a mass casualty event. I'm aware, Patterson said, which is why we need to discuss the legal implications of what's happening inside that building. Legal implications? One of the hospital lawyers stepped forward. You've been performing surgical procedures without proper credentials. You've directed other physicians to work outside their scope of practice. You've essentially taken over a civilian medical facility through military authority. Do you understand the liability exposure this creates? Emma stared at him. Do you understand that soldiers are dying without these interventions? That's not the point. That's exactly the point. Emma's voice went cold. What do you want me to do? Stop treating patients so we can discuss paperwork? Patterson held up a hand. Nobody's asking you to stop treatment, but we need to document that these procedures are being performed under emergency conditions with appropriate military authority. Otherwise, every doctor in there could lose their license. General Harding spoke up. I have written orders authorizing emergency medical operations under my command. Every civilian physician is operating under those orders. With respect, General, your authority doesn't supersede state medical licensing requirements. Emma felt rage building in her chest. So what exactly are you proposing? Patterson opened her briefcase and pulled out a stack of documents. We need waivers signed by every participating physician acknowledging they're working under emergency military protocols. We need documentation of every procedure performed, and we need a legal record establishing the chain of command. How long will that take? An hour, maybe 2, to process everything properly. Emma looked at Patterson, then at the lawyers, then back at General Harding. No, she said. Patterson blinked. Excuse me? I said no. We don't have 2 hours to play legal games. We have patients crashing on operating tables. Every minute I spend out here signing papers is a minute I'm not saving lives. The hospital lawyer's face reddened. You don't have a choice, Captain. If you continue operating without proper legal documentation, then file your complaints after everyone's alive. Emma turned to walk back inside. Captain Graves, Patterson called. If you refuse to cooperate, I'll have no choice but to recommend that the medical board pursue action against every physician participating in these procedures. Emma stopped. She turned slowly. Let me make sure I understand, she said quietly. You're threatening to destroy the careers of doctors who are currently saving lives because they haven't filled out the right forms? We're trying to protect them. You're covering your own ass. There's a difference. Patterson's expression hardened. I'm trying to prevent a legal disaster. The only disaster is happening in there because I'm wasting time talking to you instead of working. Emma's voice dropped to barely above a whisper. So here's what's going to happen. I'm going back inside. I'm going to continue treating patients. When the last soldier walks out of this hospital alive, you can serve me with whatever paperwork you want. But until then, stay out of my way. She walked toward the entrance. Captain Graves, General Harding called, they can make this very difficult for you. Emma stopped at the doors and looked back. They can try. She walked inside, letting the doors swing shut behind her. The ER noise hit her immediately. Monitors beeping, people shouting, equipment moving. She'd been outside for less than 5 minutes, but it felt like a different world. Dr. Foster was waving urgently from the burn station. Emma ran over. The burn patient's oxygen saturation had dropped to 78%. His blood pressure was plummeting. The ventilator settings were maxed out, but his lungs weren't responding. "He's not improving," Foster said, panic edging into his voice. "We've tried everything." Emma looked at the monitor. Oxygen saturation 76%. Blood pressure 82/46. Heart rate 146. Multiple organ failure was starting. The burns had triggered a massive inflammatory response, and now his body was shutting down. "We need to try ECMO," Emma said. Foster stared at her. "We don't have ECMO capability. That requires specialized equipment we don't. Great Falls has it. How long until helicopters can fly?" Colonel Nash checked his watch. "Weather's supposed to clear in 90 minutes. Emma looked at the monitor again. Oxygen saturation 74%. This patient didn't have 90 minutes. She grabbed her radio. "This is Captain Graves. I need immediate medevac authorization for a critical burn patient requiring ECMO. Patient cannot wait for weather clearance." Static crackled. Then a voice came through. "Captain, this is flight operations. We have multiple birds grounded due to weather. Flying now would be extremely dangerous." "How dangerous?" "Low visibility, high winds, icing conditions. We'd be flying instruments in a whiteout." Emma looked at the soldier dying on the table in front of her. 23 years old according to his dog tags. Somebody's son. Somebody's brother. "If we don't fly him out, he dies," Emma said into the radio. Silence. Then, "We'll need a volunteer crew. I can't order anyone to fly in these conditions." "Find someone." Emma turned to Foster. "Keep him alive for 15 minutes. I don't care how. Just 15 more minutes." She moved through the ER, checking on other patients. The craniotomy patient was still unconscious but stable. The cardiac repair was holding. The abdominal surgery patient was awake and asking for water. Webb's orthopedic patient had stabilized after the seizure. The femur fixators were in place and functioning. They were holding. Against all odds, they were still holding. Emma's radio crackled. "Captain Graves, this is Chief Warrant Officer Rodriguez. I'll fly your patient to Great Falls." "Are you sure?" "No, but I'm going anyway. Get him ready for transport." Emma felt something shift in her chest. "Thank you, Chief." "Thank me when we land safely." She coordinated with Foster to prepare the burn patient for helicopter transport. They'd need to bring portable ventilation equipment, emergency medications, and someone to monitor him during the flight. "I'll go," Foster volunteered. Emma nodded. "Keep him sedated and watch his airway. If he deteriorates in flight, you'll need to bag him manually." "Understood." 15 minutes later, they had the patient loaded into a Blackhawk. Chief Rodriguez gave Emma a thumbs up from the pilot's seat, then the helicopter lifted into the storm. Emma watched it disappear into the snow, praying the pilot's skill would be enough to get them through. She turned back to the hospital and found Dr. Cullen standing in the doorway, staring at her with an expression she'd never seen before. "What?" Emma said. "They're going to crucify you for this, aren't they? The lawyers, the medical board, all of them." Emma shrugged. "Probably. Even though you saved all these lives." "Especially because I saved these lives. It makes their paperwork look ridiculous." Cullen was quiet for a long moment. Then he spoke, his voice rough. "I'm sorry." "For what?" "For everything. For suspending you. For humiliating you. For spending 5 years treating you like you were worthless when you're—" He gestured helplessly at the ER. "When you're this." Emma looked at him. Really looked at him. She saw shame there, genuine and deep, but also something else. Understanding, maybe. Or the beginning of it. "Save your apology," Emma said. "You've got 2 more patients in yellow zone who need monitoring. Get back to work." She walked past him into the ER. The next hour blurred together. More procedures, more crises, more impossible decisions made with insufficient information. But slowly, impossibly, the chaos began to resolve. Patients stabilized. Vital signs improved. The red zone emptied as critical cases moved to yellow zone monitoring. Emma worked until her hands ached and her vision blurred from exhaustion. She worked until there were no more emergencies demanding immediate attention. Finally, she stepped back and looked around the transformed emergency room. Every soldier was alive. Some were critical. Some would need additional surgery. Some would carry their injuries for the rest of their lives. But they were alive. Emma walked to the window and stared out at the storm. The snow was finally starting to lighten. Dawn was maybe 2 hours away. Her radio crackled one last time. "Captain Graves, this is Chief Rodriguez. We made it to Great Falls. Patient is stable and being admitted to their ECMO unit." Emma closed her eyes and let out a breath she didn't know she'd been holding. "Good work, Chief." "Same to you, ma'am." The radio went quiet. Emma stood alone in the sudden silence, feeling the weight of the last 6 hours settle across her shoulders like lead. She'd done it. They'd all done it. But as she stood there, she heard voices outside the ER entrance. Official voices. Angry voices. The hospital administrator had arrived, and he'd brought more lawyers. Emma turned to face the doors as they opened, revealing a crowd of suits and stern faces. At the front stood Jennifer Patterson from the medical board, holding a thick folder of documents. "Captain Graves," Patterson said, her voice cold and formal. "I'm here to inform you that the Montana State Medical Board is opening an immediate investigation into your conduct tonight. You're being charged with practicing medicine without a license, performing unauthorized surgery, and—" The doors behind Patterson burst open. A camera crew pushed through, bright lights flooding the entrance, reporters shouting questions, a news van visible in the parking lot. And behind them, walking slowly through the crowd with military precision, came a figure Emma recognized immediately. Brigadier General James Harding. But he wasn't alone. 3 more generals flanked him, all of them wearing dress uniforms despite the early hour, and between them walked a man in a dark suit, an American flag pin on his lapel, the Secretary of the Army. Everyone in the entrance hall went silent. The secretary walked directly to Emma and held out his hand. "Captain Graves," he said, his voice carrying across the sudden quiet, "the President of the United States asked me to deliver a message personally." Emma shook his hand automatically, her mind struggling to process what was happening. "What message?" she managed. The secretary smiled. "He said to tell you." The entrance doors exploded inward, glass shattered, metal screamed. A military truck had crashed through the front of the hospital at full speed. Emma threw herself sideways as the truck's grill tore through the entrance wall. Metal shrieked against concrete. Glass exploded in all directions. The Secretary of the Army hit the ground hard, generals scrambling to cover him. The truck lurched to a stop 10 feet inside the building, its engine smoking. The driver's door hung open, swinging on broken hinges. Nobody was inside. Emma pushed herself to her feet, ears ringing from the impact. Around her, people were screaming, running, diving for cover. The camera crew's equipment lay shattered across the floor. Colonel Nash appeared at her side, weapon drawn. "Everyone back! Clear the area!" Soldiers flooded through the damaged entrance, securing the perimeter. Emma's combat instincts kicked in automatically. She scanned for secondary threats, counted personnel, assessed injuries. Jennifer Patterson was on the ground, bleeding from a cut on her forehead. One of the hospital lawyers had a dislocated shoulder. The reporters were shaken but mobile. "Medical personnel," Emma shouted. "We've got injured civilians. Move them to the yellow zone." Staff members scrambled to help. Emma grabbed Patterson by the arm and hauled her upright, pressing gauze against the head wound. "Hold this," Emma said, pushing Patterson's hand against the bandage. "You'll need stitches." Patterson stared at her, shock written across her face. You're helping me?" "That's what I do." Emma moved on to check the other injured. The lawyer with the dislocated shoulder was trying not to scream. Emma assessed the joint quickly. Anterior dislocation, straightforward to reduce if she moved fast. "This is going to hurt," she told him, "but it's better than waiting." She positioned his arm and executed a rapid reduction. The shoulder joint popped back into place with an audible click. The lawyer gasped in pain, but his face showed immediate relief. General Harding was shouting orders into a radio. "I want that truck swept for explosives, and find out who the hell was driving it." Security teams swarmed the vehicle with detection equipment. Emma watched them work while helping move the injured lawyer to a treatment area. The Secretary of the Army stood slowly, brushing debris from his suit. His security details surrounded him immediately, but he waved them back. "Captain Graves," he called. Emma walked over, still on high alert. The secretary looked at the destroyed entrance, then at Emma. "Well, that's one way to make a dramatic entrance." "Sir, are you injured?" "Bruised ego, nothing more." He straightened his jacket. "Where were we before we were interrupted?" Emma almost laughed. Almost. "You were delivering a message from the president." "Right." The secretary's expression turned serious. "The president asked me to tell you that your actions tonight represent the highest traditions of military service. You're being nominated for the Distinguished Service Cross." The words hit Emma like a physical blow. The Distinguished Service Cross was the second highest military decoration, just below the Medal of Honor. "I don't," she started. "Furthermore," the secretary continued, "your commission is being fully reinstated with immediate effect. You're also being promoted to major, effective today." Emma's throat tightened. "Sir, I don't deserve—" "That's not your decision." The secretary's voice softened slightly. 43 soldiers are alive because of you. That's not luck. That's skill, courage, and leadership under impossible conditions. Behind the secretary, Jennifer Patterson was being helped to a treatment chair by a nurse. The medical board attorney looked like she'd been hit by the truck herself. Her earlier confidence completely evaporated. General Harding appeared with an update. "Sir, the truck was reported stolen from a storage depot 3 hours ago. No explosives found. Appears to be a runaway vehicle. Parking brake failure on an incline. Pure accident." The secretary nodded. Convenient timing. Emma watched as military police began securing the scene. News crews were already reorganizing outside, cameras pointed at the destroyed entrance. This was going to be everywhere by morning. A reporter managed to slip past security and thrust a microphone toward Emma. "Captain Graves, is it true you were suspended from this hospital this morning and then took command of emergency operations tonight?" Emma stepped back, but more reporters were pushing forward. "Is it true you performed brain surgery despite being employed as a nurse?" "What do you say to allegations of practicing medicine without a license?" Colonel Nash moved to intercept them, but the secretary held up a hand. "Let her answer," he said quietly. Emma looked at the cameras, at the reporters, at Jennifer Patterson watching from her treatment chair with blood still dripping down her face. "I did what needed to be done," Emma said. "That's all. But the medical board is investigating you for—" "The medical board can investigate whatever they want. My priority was keeping soldiers alive. If that creates legal problems, I'll deal with them later." A new voice cut through the noise. "She won't have to." Everyone turned. Dr. Richard Cullen stood in the doorway to the ER proper, still wearing his blood-soaked surgical gown. Behind him stood Dr. Webb, Dr. Foster, and a dozen other hospital staff members. Cullen walked forward slowly, his face showing every one of his 62 years. "Captain Graves acted under military authority during an emergency," Cullen said, his voice carrying across the damaged entrance hall. "Every procedure she performed, every order she gave, was necessary to save lives. If the medical board wants to investigate someone, they should investigate me." Jennifer Patterson found her voice. "Dr. Cullen, you're not helping your situation." "I'm the chief of surgery at this hospital," Cullen interrupted. "I suspended Captain Graves this morning for questioning my judgment. I was wrong. Not just wrong. Catastrophically, dangerously wrong. If she hadn't been here tonight, soldiers would have died because this facility wasn't prepared for mass casualty response." He turned to face Patterson directly. "You want to investigate unauthorized medical practice? Fine. Investigate me for running an ER that couldn't handle basic trauma protocols. Investigate me for ignoring warnings about disaster preparedness. Investigate me for creating a culture where experienced medical professionals were afraid to speak up." The entrance hall had gone completely silent. Cullen looked at Emma. "I spent 5 years treating you like you were invisible, like you didn't matter. Tonight you saved lives I couldn't save. You performed procedures I couldn't perform. You led teams I couldn't lead." His voice cracked slightly. "You were the person I should have been." Emma didn't know what to say. Dr. Webb stepped forward. "I mocked her this morning, called her ghost, laughed when she tried to help." He looked at the reporters. "Tonight she talked me through an orthopedic surgery I'd never performed outside a classroom. The patient survived because she believed I could do it when I didn't believe in myself. More staff members spoke up. Nurses describing how Emma had trained them on the fly. Residents talking about procedures they'd accomplished under her guidance. One by one, they stepped forward to defend the woman they'd spent years ignoring. Jennifer Patterson looked like she wanted to sink through the floor. The Secretary of the Army watched the scene with an unreadable expression. Then he turned to Patterson. "Counselor, do you still intend to pursue this investigation?" Patterson's mouth opened and closed. The legal issues are complicated." "That sounds like a no." "Sir, I have a responsibility to... You have a responsibility to use common sense." The secretary's voice hardened. "This woman just saved 43 American soldiers under conditions that would make most physicians quit. And you want to destroy her career over paperwork? It's not about paperwork. It's about proper medical licensing, and it's about protecting your institution from embarrassment." The secretary cut her off. "I suggest you find a different way to do that, perhaps by recommending policy changes instead of persecuting heroes." Patterson's face flushed red. She looked at her documents, then at the assembled staff, then at the cameras recording everything. "I'll need to consult with the board," she said finally. "You do that." The secretary dismissed her with a look. Patterson gathered her papers and left, still pressing gauze to her head wound. Emma watched her go, feeling nothing, no satisfaction, no vindication, just exhaustion. The reporters surged forward again with questions, but General Harding's security team finally established a perimeter. The journalists were pushed back outside, still shouting queries that nobody answered. The secretary turned to Emma. "You look like you're about to fall over." "I'm fine, sir." "That's an order, not a request." "When did you last sleep?" Emma tried to remember. "Before my shift yesterday, maybe 30 hours ago." "Unacceptable. General Harding, please ensure Major Graves gets at least 6 hours of rest before any further duties." "Yes, sir." Emma wanted to protest, but her body was already shutting down. The adrenaline that had carried her through the night was evaporating, leaving only bone-deep fatigue. Colonel Nash appeared with a clean uniform. "There's a room on the 3rd floor we're using as command quarters. It's quiet." Emma nodded. She looked back at the ER one more time, checking on patients through the windows. Everyone was stable. The immediate crisis had passed. She let Nash guide her toward the elevators. Behind her, she heard Dr. Cullen's voice one more time. "Captain Graves?" Emma turned. Cullen stood alone in the damaged entrance hall, looking small and tired. "Thank you. For saving them. For saving us." Emma met his eyes. "Don't thank me. Be better." She walked away before he could respond. The room on the 3rd floor was small and sterile. Just a bed, a chair, and a window overlooking the parking lot. Emma sat down and started unlacing her boots. Her hands were shaking, not from fear, not from stress, just the physical aftermath of 6 hours operating at absolute peak performance. She got one boot off before Colonel Nash knocked on the doorframe. "You should know," he said quietly, "General Harding is already fielding calls from Washington. The Joint Chiefs want to meet with you. There's talk of a permanent position with Army Medical Command." Emma didn't look up. "I'm not interested." "Emma, I said I'm not interested." She got the second boot off. "I left for a reason, David. That reason hasn't changed." Nash leaned against the doorframe. "You can't keep hiding from what you are." "I'm not hiding. I'm choosing. You chose tonight. You stepped back into it the second those helicopters landed." Emma was too tired to argue. "What do you want me to say?" "I want you to stop pretending you're fine." Nash's voice softened. "I was there in Kandahar. I saw what it cost you. But I also saw what you just did tonight. You're still the best combat surgeon I've ever seen. The Army needs people like you." "The Army has plenty of surgeons." "Not like you." Emma finally looked at him. "The last time I believed that, half my team died because I couldn't work fast enough. I'm not doing that again. That wasn't your fault. It was my responsibility, which makes it my fault." She stood up. "I need sleep, David. Please." Nash studied her face for a long moment. Then he nodded. 6 hours. Then Harding wants a debrief." He left, closing the door quietly. Emma lay down on the bed, fully clothed. Her mind was still racing, replaying procedures, second-guessing decisions, calculating what she could have done better. The craniotomy patient. Had she placed the burr holes optimally? Should she have used 3 instead of 2? The abdominal surgery. Had she checked thoroughly enough for additional injuries? What if she'd missed something? The burn patient on the helicopter. Had she made the right call sending him into that storm? She forced her eyes closed and tried to quiet her thoughts. Sleep came in fragments. Nightmares mixed with memories mixed with the faces of soldiers she'd treated tonight. She saw the young man with the head injury, saw the woman with the abdominal wound, saw them dying on operating tables while she worked frantically, always too slow, always failing. Emma jerked awake. Sunlight streamed through the window. She checked her watch, 1:47 p.m. She'd slept almost 8 hours. She sat up quickly, panic flashing through her. The patients. Who was monitoring them? What if someone had crashed while she slept? Emma pulled on her boots and headed for the door. She found the ER transformed. Military medical teams had arrived overnight, bringing proper equipment and specialist personnel. The damage from the truck crash had been cleared. Temporary walls had been erected to seal off the destroyed entrance. Dr. Foster saw her and walked over. "Easy, Captain. Everyone's stable. We've got full coverage." The craniotomy patient? Awake and responsive. Neurosurgery team from Great Falls arrived 2 hours ago and evaluated him. "They're amazed by your field work. He's going to recover fully." Emma felt tension drain from her shoulders. The others? Cardiac repair is doing well. Orthopedic patient is headed to surgery for definitive fixation of his fractures. Abdominal surgery patient is eating breakfast and complaining about hospital food, which the docs say is a good sign. Foster smiled slightly. The burn patient made it to Great Falls and is on ECMO. Critical but stable. Emma nodded, processing the information. They'd done it. Against impossible odds, every patient had survived the night. "There's something else," Foster said. "You should see this." He led her to the nurse's station and pulled up a tablet showing news coverage. Emma's face filled the screen. The footage showed her in the damaged entrance hall, covered in blood, responding to reporters' questions with quiet determination. The chyron read, "Military nurse saves 43 soldiers after being fired from hospital." "It's on every network," Foster said. CNN, Fox, MSNBC. Your national news. Emma watched herself on screen, barely recognizing the exhausted woman in surgical scrubs. The coverage cut to footage of Dr. Cullen defending her, then to the Secretary of the Army's announcement of her promotion. Another clip showed Jennifer Patterson leaving the hospital with no comment, lawyers trailing behind her looking shell-shocked. The medical board released a statement an hour ago, Foster continued. They're dropping all investigations and issuing a formal apology. They're also announcing a review of emergency preparedness standards across Montana. Emma set down the tablet. "Where's Dr. Cullen?" "Conference room. He's been there since dawn with hospital administration and military brass." Emma walked towards the conference room, her mind already shifting to what came next. The immediate crisis was over, but the aftermath would be complicated. She found the conference room packed with people, hospital administrators, military officers, legal counsel, and Dr. Cullen, sitting at the head of the table, looking like he'd aged 10 years overnight. General Harding saw her enter and stood. "Major Graves." "Good, you're awake." Everyone turned to look at her. Emma suddenly became aware that she was still wearing yesterday's blood-stained uniform. She probably looked and smelled like she'd been through a war zone, because she had. "Gentlemen," Harding continued, "Major Graves has just joined us. We were discussing the future of emergency medical services at Ridgeline Memorial." Emma found a chair along the wall. "I'm just here to observe." "Actually, we need your input." This from a hospital administrator Emma didn't recognize. "The board of directors has requested that you consult on rebuilding our trauma protocols." "I don't work here anymore," Emma said. "I was suspended, remember?" Awkward silence filled the room. Dr. Cullen spoke up. "Your suspension has been rescinded. The hospital would like to offer you a position as Director of Emergency Services." Emma stared at him. "You're joking." "I'm not. Full authority over ER operations. Competitive salary. Complete autonomy to implement whatever protocols you see fit. 24 hours ago, you had me escorted out by security. 24 hours ago, I was an arrogant fool who couldn't see what was standing right in front of me." Cullen's voice was steady. I'm offering you this position because you're the best person for it. What you did last night proved that beyond any doubt. Emma looked around the room. Every face showed agreement. These were the same administrators who'd allowed her suspension, the same leadership that had fostered a culture where nurses were invisible and questioning authority meant punishment. No, Emma said. The administrator blinked. I'm sorry? I said no. I don't want the position. Major Graves, Cullen said carefully, perhaps you need time to think about... I don't need time. The answer is no. Emma stood. This hospital has fundamental problems that go beyond trauma protocols. You don't need a new director of emergency services. You need a complete cultural overhaul. The administrator's face reddened. That's quite an accusation. It's an observation based on 5 years of experience. Emma's voice stayed level. You created an environment where experienced medical professionals were afraid to speak up, where hierarchy mattered more than patient care, where anyone who questioned authority was punished. One night of crisis doesn't fix that. She turned to leave. Wait, Cullen said. What would fix it? Emma paused at the door. She looked back at the assembled leadership, people who'd spent years maintaining a system that prioritized their comfort over patient safety. Fire everyone in this room, Emma said. Bring in leadership that actually listens to their staff. Implement transparent reporting systems where safety concerns can be raised without retaliation. And stop treating nurses like they're invisible furniture. She walked out before anyone could respond. General Harding caught up with her in the hallway. That was quite a statement. They needed to hear it. The offer from Army Medical Command still stands. We could use someone willing to shake things up. Emma stopped walking. David, I appreciate what you're trying to do, but I'm not going back to active duty. Then what will you do? She didn't have an answer. Her phone buzzed. Emma pulled it out to find dozens of missed calls and text messages. Most were from numbers she didn't recognize. A few were from old military contacts she hadn't heard from in over a year. One message caught her attention, from Sarah, the young nurse who'd assisted with the craniotomy. Thank you for believing in me last night. I've never felt more capable in my entire career. You changed something in me. Emma stared at the message for a long moment. Major Graves? Harding prompted. Emma looked up. I need to think about all of this. Can you give me 24 hours? Harding nodded. Take the time you need. But Emma, don't waste this. What you did last night matters. The question is what you're going to do with it. He left her standing in the hallway. Emma walked back to the ER, moving through the transformed space. Military medical teams worked efficiently alongside civilian staff. Patients were being stabilized, transferred, treated with professional competence. She found Sarah at a monitoring station, checking vitals on one of the yellow zone patients. How's he doing? Emma asked. Sarah jumped slightly, then smiled. Stable. He's probably ready to be downgraded to green zone. Good work. Emma paused. I got your message. I meant every word. I've been a nurse for 3 years and I've never felt like I actually mattered until last night. You made me believe I could do things I thought were impossible. Emma looked at the young woman. She saw herself in Sarah, someone capable but uncertain, working in a system that didn't value her contributions. You were always capable, Emma said. You just needed someone to give you the chance to prove it. That's what I want to do, for other people, the way you did for me. Sarah hesitated. Is it true you turned down the director position? It's true. Why? You could change everything here. Emma shook her head. I can't fix this place from the inside. The problems are too deep, but you can. You and the other staff who saw what's possible last night, you're the ones who have to demand better. Sarah nodded slowly. We're planning to meet, the nurses. We want to present recommendations to administration about safety protocols and reporting structures. That's exactly what you should do. Will you help us? Emma considered. I'll review your recommendations if you want, but this needs to be your fight. I can't be here to do it for you. Where will you be? I don't know yet. Emma left Sarah to her work and walked through the hospital one final time. She passed rooms where soldiers recovered, monitored by dedicated staff. She saw Dr. Webb reviewing X-rays with newfound confidence. She saw Dr. Cullen speaking quietly with a patient's family, his earlier arrogance replaced by genuine humility. Things were changing here. Maybe not as fast as they should, but the cracks in the old system were showing. Emma's phone rang. Unknown number, she answered. This is Emma Graves. Major Graves, this is Colonel Patterson from Medical Command. I'm calling to discuss a new initiative we're developing. We want to create rapid response medical teams capable of deploying to mass casualty events anywhere in the country, teams led by surgeons with combat experience. We'd like you to head the program. Emma walked to the window overlooking the parking lot. Outside, news vans were still camped beyond the security perimeter. Reporters waiting for another statement, another soundbite. Tell me more, Emma said. She listened as Colonel Patterson outlined the program. Mobile surgical teams, advanced training protocols, direct authority over emergency response operations. Everything she'd proven was possible last night, formalized into a permanent structure. When would this start? Emma asked. Immediately if you accept. We're fast-tracking approval at the highest levels. Emma thought about Sarah and the other nurses finding their voices, about Dr. Cullen learning humility, about the cultural changes that might or might not happen at Ridgeline Memorial. She thought about the 43 soldiers who'd survived because she'd been in the right place at the right time with the right skills. She thought about running from her past for 18 months, trying to hide from what she was. I need to speak with someone first, Emma said. Can I call you back in 2 hours? Of course. Emma ended the call and made another one. Colonel Nash answered immediately. Emma? I need the truth about something, about Kandahar, about why my team really died. Silence on the other end. David, please. I need to know. Nash took a long breath. The truth is classified, you know that. Then declassify it. Or tell me off the record, but I can't move forward without understanding what actually happened. More silence. Then Nash spoke, his voice heavy. Your team died because command sent you into an area that intelligence had flagged as hostile. You were told it was secure. It wasn't. You did everything right, Emma. You kept people alive in impossible conditions. The failure was in the mission planning, not in your hands. Emma closed her eyes. Why didn't anyone tell me? Because admitting command screwed up would have meant accountability at levels that make people uncomfortable. Easier to let you take the blame internally and disappear quietly. I didn't take blame. I just left. Same result. Emma opened her eyes and stared at her reflection in the window. I'm being offered a position heading a new rapid response medical program. I know. I was on the call when they discussed it. Should I take it? That's not my decision. But what do you think? Nash was quiet for a moment. I think you've been punishing yourself for something that wasn't your fault. I think you're the best combat surgeon I've ever seen. And I think those 43 soldiers last night proved you're still capable of saving lives that nobody else could save. But only you can decide if you're ready to step back into it. Emma watched hospital staff move through the parking lot below, saw soldiers helping civilians, saw the chaotic collaboration that had saved so many lives. Thank you, she said quietly. For what? For telling me the truth. She ended the call and stood at the window for a long time, thinking. Finally, she pulled out her phone and dialed Colonel Patterson's number. This is Emma Graves, she said when he answered. I accept the position. When do I start? Report to Fort Belmont in Virginia by 0800 hours Monday, Colonel Patterson said. Bring your service records and be prepared for immediate deployment planning. Emma ended the call and stood at the window, watching snow melt in the afternoon sun. 3 days. She had 3 days to close out her life in Ashford and step back into the world she'd spent 18 months running from. Her phone buzzed again. This time, it was a text from an unknown number. Major Graves, this is Sergeant Marcus Hall. You pulled me out of a burning Humvee in Kandahar. Saw the news. Thank you for still being you. Emma stared at the message. She didn't remember a Marcus Hall specifically. Just the chaos of that day, the flames, the screaming, the desperate work to keep people breathing. Another message appeared. Then another. Soldiers she'd treated years ago. People she'd saved and forgotten about because forgetting was easier than remembering. You saved my life at Black Ridge. I named my daughter Emma. You told me to stay awake and keep fighting. I did. 2 years sober now. I wouldn't be here without you. My kids wouldn't exist. Thank you. The messages kept coming, a flood of gratitude from people whose names she'd never learned but whose lives she'd touched in moments of crisis. Emma's throat tightened. She'd spent so long focusing on the ones she couldn't save that she'd forgotten about the ones she did. A knock on the doorframe made her look up. Dr. Cullen stood in the hallway, still looking exhausted, but somehow more solid than before. Less like a man playing a role, and more like someone who'd been stripped down to his foundation and was figuring out how to rebuild. "May I come in?" he asked. Emma gestured to the empty chair. Cullen sat down slowly, like his joints hurt. "I heard you accepted the Army position. Word travels fast. Small hospital, smaller after last night." He looked at his hands. "I wanted to apologize properly, without an audience." Emma waited. "I spent 30 years building a career," Cullen said quietly. "Chief of surgery, respect, authority. I thought that meant something, that it proved I was competent." He laughed bitterly. "Last night showed me how little any of that actually matters when people are dying." "You performed a successful cardiac repair," Emma said. "That takes skill. I performed it because you talked me through every step. Without you, I would have frozen, just like I froze during that first convoy arrival." Cullen met her eyes. "I suspended you because you threatened my ego, because you saw through all my credentials and titles to the insecure man underneath. I couldn't handle that." Emma didn't deny it. "The truth is," Cullen continued, "I haven't been a real doctor in years. I've been an administrator who occasionally performs surgery. I forgot what it means to actually save lives." He paused. "You reminded me, and it terrified me." "What will you do now?" Emma asked. Cullen shrugged. "The board asked for my resignation this morning. I gave it to them. Effective end of the month." "I'm sorry." "Don't be. It's the right decision." He stood to leave, then stopped. "For what it's worth, you would have been an extraordinary director of emergency services. This hospital's loss is the Army's gain." He walked to the door, then turned back one more time. "I hope wherever you go, you find people who see you for what you are from the beginning. You deserved better than what we gave you." Emma watched him leave. She felt no satisfaction in his fall, no vindication, just a quiet acknowledgement that sometimes the price of ego was higher than anyone wanted to pay. Her phone rang again. General Harding. "Major, we have a situation. Can you come to the command center?" Emma found the makeshift command center set up in what used to be the hospital cafeteria. Military communications equipment filled the space. Officers huddled over maps and computer screens. Harding was in the center of it, coordinating with someone via satellite phone. He saw Emma and waved her over. "We've got a developing crisis in Wyoming," he said after ending the call. "Chemical plant explosion outside Laramie. Mass casualty event. Local hospitals are completely overwhelmed. We're deploying resources, but it'll take hours to get proper medical teams in place." Emma's mind immediately started processing. Chemical exposure protocols, burn treatments, respiratory support for inhalation injuries. How many casualties? At least 60, possibly more. The plant employed 200 people, and the explosion happened during shift change. Emma looked at the map. Laramie was 4 hours away by road, maybe 90 minutes by helicopter. "You're thinking about going," Harding said. It wasn't a question. "I'm thinking someone needs to, and I'm available. You're supposed to report to Fort Belmont in 3 days." "Then I better work fast." Harding studied her face. "This is what the job will be like. Crisis to crisis. No breaks, no downtime. Just constant deployment to disasters nobody else can handle." "I know. Are you sure you're ready for that?" Emma thought about the last 18 months. The quiet shifts, the invisible existence, the constant feeling of being incomplete, like she was playing a role instead of living her life. "I'm ready," she said. Harding nodded once. "I'll have a helicopter ready in 20 minutes. Take whoever you need." Emma turned to scan the room. She spotted Dr. Webb reviewing patient charts near the communications station. "Webb," she called, "how do you feel about chemical exposure protocols?" He looked up, startled. "I covered them in residency, but I've never actually—" "Good enough. We're going to Wyoming. Be on the helipad in 15 minutes. We're— What? Chemical plant explosion. Mass casualties. I need an assistant who can follow orders and won't freeze under pressure. You proved last night you can do both." Webb's eyes went wide. Then he nodded. "I'll be there." Emma found Sarah next. How confident are you with respiratory emergencies? After last night? More confident than I've ever been. Pack a go bag. We're deploying to Wyoming in 15 minutes. Sarah didn't hesitate. Yes, ma'am. Emma assembled a team quickly. 2 more nurses, a respiratory therapist, and Dr. Foster, who volunteered without being asked. They grabbed equipment from the military supplies and loaded it onto the helicopter. As they prepared to board, Emma saw a familiar figure approaching across the parking lot. Colonel Nash walked up and handed her a sealed folder. Your service record, fully updated with last night's commendation. Figured you'd need it at Fort Belmont. Thank you. Nash looked at the helicopter, at the team loading equipment. You're deploying already? There are people who need help. There always are. Nash smiled slightly. That's why you do this. Emma realized he was right. It wasn't about proving anything or earning recognition. It was simply that when people were dying and she had the skills to help, doing nothing wasn't an option. David, she said quietly, thank you for telling me the truth about Kandahar, for not letting me keep running. You stopped running the moment those helicopters landed. I just helped you see it. They shook hands. Then Emma boarded the helicopter. The rotor spun up. Through the window, Emma watched Ridgeline Memorial fall away below. The damaged entrance, the temporary military installations, the news vans still camped outside the perimeter. She'd arrived there 5 years ago hoping to disappear, to be just another nurse following orders and living quietly. Instead, she'd proven something she'd tried to forget. Some people are built for crisis, built to lead when everything falls apart, built to make impossible decisions and live with the consequences. The helicopter banked west toward Wyoming. Emma checked her equipment, reviewed chemical exposure protocols in her mind, and mentally prepared for whatever they'd find when they landed. Dr. Webb sat across from her, looking nervous but determined. Sarah reviewed her notes with focused intensity. Dr. Foster had his eyes closed, probably running through treatment procedures. They were ready. 90 minutes later, the helicopter descended toward a scene of controlled chaos outside Laramie. The chemical plant was still burning, black smoke pouring into the sky. Emergency vehicles surrounded a makeshift triage area. Emma could see overwhelmed medical personnel struggling to manage the sheer volume of casualties. They landed 50 yards from the triage zone. Emma jumped out before the rotor stopped spinning. A local EMT supervisor ran up, his face showing relief. Are you the military medical team? We are. What's the situation? 63 casualties, most have chemical exposure. Respiratory distress, burns. We've got 6 critical who won't survive transport to the nearest trauma center. The supervisor looked desperate. I don't know what to do with them. Emma scanned the scene. Where are the criticals? In the red tent. Show me. She followed him to a large tent where 6 patients lay on gurneys in various states of distress. Emma assessed them quickly. 3 with severe respiratory burns, 2 with chemical exposure causing pulmonary edema, 1 with both burns and crush injuries from debris. All of them dying without immediate intervention. Emma turned to her team. Webb, Foster, you're with me on the respiratory cases. Sarah, coordinate with local staff on the chemical exposure protocols. Get me comprehensive patient counts and severity levels. Move. They scattered to their assignments. Emma grabbed an intubation kit and approached the first patient. Young woman, maybe 30, struggling to breathe through damaged airways. Emma could hear the stridor from 10 feet away. She worked quickly, securing the airway and placing her on a ventilator. Then she moved to the next patient, and the next. The hours blurred together. Emma performed emergency procedures in a tent with inadequate lighting and basic equipment. She talked Webb through treatments he'd never attempted. She made split-second decisions about who could wait and who needed immediate care. It was Ridgeline Memorial all over again. Except this time, Emma wasn't the invisible nurse watching from the sidelines. She was the commander, making it all work. By the time sunset painted the sky orange and red, all 63 patients had been stabilized and either treated on-site or transferred to hospitals with appropriate specialty care. 0 deaths. Emma stood outside the red tent watching the last ambulance pull away. Her uniform was soaked with sweat and stained with chemicals. Her hands ached. Her voice was hoarse from shouting orders. She'd never felt more alive. Dr. Webb approached, looking exhausted but triumphant. We did it. You did it, Emma corrected. I just pointed you in the right direction. That's not true and you know it. Webb looked at her seriously. You saved lives today that I couldn't have saved alone, that none of us could have saved alone. Sarah joined them, along with Dr. Foster and the other team members. They looked like they'd been through a war. In a way, they had. This is what you do? Sarah asked. Just go from crisis to crisis? Emma nodded. Starting Monday? Yes, that's exactly what I'll do. I want to do it too, Sarah said immediately. Whatever training I need, whatever qualifications, I want to be part of teams like this. Webb spoke up. Same here. This is what medicine is supposed to be. Not paperwork and politics, actual lives being saved. Emma looked at them. Civilians who 24 hours ago had been working routine shifts at a regional hospital. Now they were requesting deployment to disaster zones. It's not easy, Emma warned. It's constant pressure, constant crisis. You'll see things that give you nightmares. But we'll save people who would otherwise die, Sarah said. That matters more than easy. Emma smiled. Then when you get back to Ashford, start applying to rapid response training programs. Tell them Major Graves recommended you. They flew back to Montana as darkness fell. Emma dozed on the helicopter, her mind finally quiet after 36 hours of constant crisis management. When they landed at Ridgeline Memorial, news crews were waiting. But this time, Emma didn't avoid them. She walked directly to the cameras. Major Graves, a reporter called. Can you confirm you just returned from responding to the Wyoming chemical plant explosion? I can confirm my team responded and all casualties were successfully treated. Is this the new rapid response program we've been hearing about? It will be, starting Monday. What would you say to critics who still question your credentials? Emma looked directly at the camera. I'd say credentials matter less than capability. Titles matter less than results. And the only measure that truly counts is whether people live or die based on what you do in the moment when it matters most. What about your time at Ridgeline Memorial? Do you feel vindicated? Emma thought about that question. About 5 years of being invisible. About suspension and humiliation. About proving everyone wrong. I don't need vindication, she said finally. I just needed the chance to do the work I was trained for. Ridgeline Memorial gave me that chance, even if they didn't mean to. And the soldiers who survived are the only vindication that matters. She walked away from the cameras and headed inside one last time. The ER had returned to normal operations. Military equipment was being packed up. Civilian staff had resumed their routines. The crisis had passed and life continued. Emma found the craniotomy patient awake in a recovery room, talking with his family. He saw her and his eyes lit up. You're her, he said, the one who saved me. Emma approached the bed. How are you feeling? Like I got hit by a truck, but alive. The neurosurgeon said if you hadn't relieved the pressure when you did, I'd be brain dead. He grabbed her hand. Thank you. Emma squeezed his hand briefly. Just doing my job. Your job saved my life. She visited each of the soldiers she'd treated, checking on their recovery. Every one of them thanked her. Several asked if they could stay in touch. One insisted on getting a photo together. By the time Emma finished her rounds, it was past midnight. She found herself standing in the empty ER, looking at the space where she'd spent 5 years being invisible. The trauma bays where she'd been ignored. The supply closets where she'd hidden to avoid confrontation. The nurse's station where she'd been humiliated. It all looked smaller now, less significant. Saying goodbye? Emma turned to find Dr. Foster leaning against the doorframe. Something like that, she said. Foster walked over to stand beside her. You changed this place. Not just last night, but over 5 years. You showed us what real medicine looks like, what real dedication means. Some of us were paying attention. Not enough of you. No, Foster agreed. Not enough. But the ones who were paying attention are making changes. Sarah's organizing the nurses. Webb is pushing for updated trauma protocols. Even some of the administrators are asking difficult questions about culture and safety. Emma nodded. Good. Keep pushing. Don't let them slip back. We won't. Foster held out his hand. Thank you, Major, for everything. They shook hands. Then Emma walked out of Ridgeline Memorial Hospital for the last time. She spent the next 2 days closing out her apartment, packing her minimal belongings, and preparing for the move to Virginia. The news coverage continued. Interviews with saved soldiers, statements from military leadership, speculation about the new rapid response program. Through it all, Emma stayed focused on the work ahead. Monday morning arrived cold and clear. Emma loaded her truck and took one last look at Ashford, Montana. The mountains, the quiet streets, the town where she'd tried to disappear. She'd failed at disappearing, but she'd succeeded at something more important, finding her way back to who she really was. The drive to Fort Belmont took 2 days. Emma arrived early Wednesday morning to find a dedicated facility for the Rapid Response Program. State-of-the-art training areas, advanced medical equipment, a staff of physicians and specialists waiting to be molded into crisis response teams. Colonel Patterson met her at the entrance. "Welcome to your new command, Major. Ready to build something unprecedented?" Emma looked at the facility, at the people who would become her team, at the mission that would define the rest of her career. "Let's get started," she said. The first team training session began at 0900 hours. Emma stood in front of 40 medical professionals, doctors, nurses, specialists, all of them experienced, all of them accomplished. "Most of you have impressive credentials," Emma began. "Degrees from top schools, years of experience, certifications in multiple specialties." She paused. "None of that matters here. What matters is whether you can perform emergency procedures in the back of a moving helicopter during a storm, whether you can make life or death decisions with incomplete information, whether you can lead teams through chaos when everything is falling apart." She looked at each face. "Over the next 6 months, I'm going to break you down and rebuild you. It won't be comfortable. You'll question whether you're capable. You'll want to quit. Some of you will quit." Emma's voice hardened. "But the ones who make it through will become something rare. You'll become the people who run toward disasters when everyone else is running away. The people who save lives that nobody else can save. The people who prove that skill and determination matter more than titles or credentials." She could see doubt on some faces. Determination on others, fear mixed with excitement. This program exists because 43 soldiers survived a mass casualty event that should have killed them. It exists because ordinary medical professionals stepped up and performed extraordinary medicine under impossible conditions. It exists because when people are dying, credentials don't matter. Only capability matters. Emma paused one more time. "I'm not here to make you comfortable. I'm here to make you capable. Welcome to the program. Training starts now." She spent the next 6 months doing exactly what she promised, breaking down egos, building up skills, pushing people past their limits, and showing them they were stronger than they believed. She ran simulation after simulation, mass casualties, chemical exposures, combat wounds, natural disasters. Every scenario designed to create maximum chaos and force split-second decisions. Some people quit. Others thrived. By the end of 6 months, Emma had forged the first rapid response team. 20 medical professionals who could deploy anywhere in the country within 4 hours and handle whatever crisis they found. The first real deployment came 7 months after Emma took command. Hurricane damage in Louisiana, flooded hospitals, overwhelmed medical infrastructure. The call came at 0300 hours, and Emma's team was wheels up by 0600. They spent 2 weeks in Louisiana treating thousands of patients and establishing temporary medical facilities. Emma's training proved its worth. Her teams operated efficiently under conditions that broke civilian medical personnel. More deployments followed. Tornado damage in Oklahoma, wildfire evacuations in California, industrial accidents, mass shootings, natural disasters. Every crisis was different. Every deployment tested them in new ways, but they never lost a patient they could have saved. 1 year after leaving Ridgeline Memorial, Emma stood in the Pentagon briefing military leadership on the Rapid Response Program's first-year results. "We've completed 37 deployments," she reported, "treated over 15,000 patients in crisis conditions. Our mortality rate in critical cases is 40% lower than standard emergency response." A general asked the obvious question, "What makes your team so effective?" Emma thought about that, about Sarah performing procedures she'd never attempted, about Webb finding confidence under pressure, about ordinary people becoming extraordinary when lives depended on it. "We train people to stop worrying about credentials and start focusing on capability," Emma said. "We teach them that being scared is normal, but freezing is unacceptable. And we show them that the best medical care happens when you trust your training and refuse to give up on patients." The briefing ended with approval for program expansion. Emma was authorized to recruit and train 3 additional teams. As she left the Pentagon, her phone buzzed with a message from Dr. Foster. Thought you should know. Ridgeline Memorial just hired a new chief of surgery. Young, female, former military. First thing she did was implement your trauma protocols and create a culture committee to address staff concerns. Changes are happening. Emma smiled. Changes were happening everywhere. Small revolutions led by people who'd been taught they didn't matter, now proving they absolutely did. That evening, Emma sat in her small apartment at Fort Belmont reviewing applications from medical professionals wanting to join the program. Hundreds of requests from doctors and nurses tired of bureaucracy and politics, wanting to do work that actually mattered. She approved 30 candidates for the next training cycle. Her phone rang. Unknown number. Major Graves. Ma'am, this is Sergeant Marcus Hall. We spoke after the Ridgeline incident. I'm calling because my daughter was in a car accident tonight and the paramedics aren't sure she'll make it to the hospital. They're asking if I know anyone who could advise them. Emma sat up immediately. Put them on speaker. She spent the next 20 minutes talking paramedics through emergency procedures, guiding them through a difficult airway management situation and stopping internal bleeding. By the time they reached the hospital, the girl was stable. Hall came back on the line, his voice shaking. You just saved her. Again. First me, now my daughter. Emma felt the familiar weight of responsibility settle across her shoulders. Get to the hospital, Sergeant. Be with your family. She ended the call and sat in the darkness of her apartment, thinking about cycles, about how the people you save go on to have families, how those families become part of the chain of lives preserved, how one person refusing to give up in a critical moment creates ripples that spread farther than anyone can measure. Emma thought about the ghost nurse everyone ignored, about 5 years of being invisible, about the night that changed everything. She didn't regret those years anymore. They'd taught her something important, that capability doesn't require recognition, that competence doesn't need applause, that the real power lies in knowing what you're capable of, even when nobody else sees it. And when the moment comes that demands everything you have, you don't hesitate. You just do the work. Emma stood and walked to her window, looking out at Fort Belmont. Somewhere in that facility, 40 people were training for tomorrow's deployments, learning to trust themselves, learning to lead through chaos, learning that credentials are what you bring to the table, but capability is what you prove when the table catches fire. Her phone displayed another message. This one from Sarah. Just got accepted to the Rapid Response Training Program. I'll see you in 2 weeks, Major. Thank you for showing me who I could become. Emma typed a reply. You always were that person. You just needed permission to believe it. Welcome to the team. She hit send and looked at her reflection in the dark window. The invisible nurse was gone. The ghost had become something else entirely. Not a hero. Heroes were for movies and medals. Just someone who refused to stop working when people needed help. Someone who'd learned that the greatest strength isn't in demanding recognition. It's in knowing your worth regardless of who sees it. Emma Graves had spent 5 years being invisible at Ridgeline Memorial Hospital. And then, when it mattered most, she'd shown everyone exactly what invisible people are capable of when you finally give them the chance. Not for revenge, not for vindication. Just for the simple truth that some people are built to save lives, and no amount of dismissal or disrespect can change what they are. The work continued. The deployments never stopped. The crises kept coming. And Emma met every single one exactly the way she'd met that first convoy arriving in a Montana snowstorm. With steady hands, clear focus, and the absolute certainty that she wouldn't let anyone die if she could prevent it. Because that's what real capability looked like. Not credentials, not titles, not recognition, just the work, every single day, no matter what. She turned from the window and started preparing for tomorrow's training session. There were more lives to save, more people to teach, more impossible situations to prove were actually possible. And Emma Graves, the nurse nobody respected, the ghost they ignored, the woman they tried to erase, was exactly where she belonged, leading the way forward, one life at a time.